Okay, good morning. I'm Dr. Klayman. Welcome to the Self-Healing Technique Seminar. We're going to start in a few minutes. Sorry we started a little late. We had a little difficulty getting set up here, but we're now ready to go. And the whole purpose of this is to teach you techniques that you can do on your own. You know, we're in an interesting time the last few years in our country and the world, and a lot of people have gotten some advice maybe that wasn't so good, and so people have had to learn how to take care of themselves for certain things. We want to help them with some of these techniques that you can do on your own. Actually, some of these techniques we're going to teach you your doctor doesn't know about. We're going to teach you how to get rid of headaches. We're going to teach you how to balance your hips so that the leg length is the same, which is important. We're going to teach you how to correct asthma quickly. All these things are easy. And so that's why we're teaching them to lay people and to other practitioners, because you don't have to have a background in chiropractic or in medicine to do these things. Now, when I say that, let me preface that with saying we're not giving any medical advice. If you have some disease, go see your doctor. So let's get that out of the way right away, and then we're going to start teaching some of these things. I've been a chiropractor for over 40 years, and along the way you pick up at seminars or from other practitioners, you pick up various techniques and methodologies that work, and when you find things that work, you stay with them. And I would say I was a very basic, average chiropractor for about the first 5 years of my practice. And I was treating mostly back pain and neck pain, sciatic pain once in a while, a few headaches, but nothing very exotic. We weren't doing asthma, we weren't doing allergies, digestive disorders, and things like that, which I found out later I could treat when I learned how to do these techniques. So about 5 years into my career, I heard about Dr. Victor Frank, who was a student of the original developer of applied kinesiology. You know, kinesiology means muscle testing. George Goodhart developed this whole system of muscle testing after two medical doctors by the name of Kendall and Kendall came out and started talking about muscle testing. So if you wanted to test strength of a bicep versus another bicep, you could do a regular strength test and see if this person could hold this but they couldn't hold this, well, you knew that that bicep was weak. Or a quadratus, you could do this test, and then if that one went weak, you know there was weakness in the leg. Those are the basic muscle testing that Kendall and Kendall, the two medical doctors, came out with originally. Goodhart expanded on that, George Goodhart, and he found out by reasoning that when you were very small, before you had a spinal cord and a spinal column, you had what we call a notochord. And your notochord was this big, because you were only that big. You were in the womb. And there were nerve connections coming out of that notochord, like you see here. See these nerves coming out on the side between the vertebrae? There were nerve connections that led to organs and muscles. And Goodhart reasoned that those connections that you had before birth, where a nerve would come out and go to an organ and go to a muscle, those connections stayed the same as you got bigger and the muscles and the organs migrated and they went out to, and you became a big body. The nerve connections stayed the same. And so we know that, for instance, from the middle of the thoracic spine, so this is the cervicals, there are 7 cervicals and 12 thoracic vertebrae and 5 lumbar vertebrae, 24 vertebrae separated by discs. We know that from anatomy, the nerve coming out between the 9th and 10th thoracic vertebrae goes to the adrenal glands, which sits on top of your kidney, which secretes adrenaline so you can run around and have fun all day. And it also goes to the sartorius muscle, which is a muscle that allows the leg to do this. So Goodhart reasoned that if one of those sartorius muscles were weak, probably there was some damage also or some weakness in the adrenal glands. Or if somebody came in with fatigue, he would test the sartorius muscles and find out one of these muscles or both of these muscles weak. Then he reasoned that if he could do something to strengthen up the sartorius muscle, He had done something to help the adrenal gland, and the person would have more energy. So those connections exist throughout the body. So when I learned applied kinesiology, it was a lot of work. I didn't like it that much. You had to test 8 pairs of muscles before you would do anything to help the person. And then Dr. Frank and his team developed total body modification, which is a technique of using one muscle to test, and we're going to teach you how to do that today. And you could touch various reflex points around the body. So if I want to know if somebody's adrenal glands are weak, I test this muscle and I touch the adrenal gland reflex point. If it goes weak, I know that there's a problem in the adrenal glands. So we're going to teach you how to do some of those things today. And that's basically how this muscle testing developed and improved with total body modification and Dr. Frank and his team. So I started studying that in the late 80s, early 90s. And I remember the first patient that came in, she had asthma. And he had taught us how to treat asthma. So I did the asthma technique on her. It took less than a minute. And then she comes back 2 days later and I said, "How's your asthma?" She says, "My asthma's gone." And I was like shocked. I thought to myself, oh my God, this stuff really works. And so I pretended to be very professional and I said, "Well, of course your asthma's gone. We just did the asthma technique on you." Meantime, I'm inside thinking, oh my God. And so after that happened, I started using this more and more, and I found similar results. So we're going to teach you how to do the asthma technique today. If you or any of your family has asthma, you can use this on them. We're also going to teach something that, and for me this is sort of a little bit of a coming out party, because my patients know that we do some things that are a little unusual, that are not mainstream. And so in 2008, I was in India studying, taking some meditation courses. And I treated a gal there for a wheat allergy and celiac disease. And we fixed it. She went back home to Australia and she called my mentor, Dr. Frank, and she said, "I just got fixed for celiac disease in India by Dr. Klayman. I want to learn how to do TBM." And she went to the United States and studied with him. Well, I spoke to her about 5-6 years ago, and she happened to mention to me that after she came back from studying with Dr. Frank, her healing abilities had gotten amped up, and her long-distance diagnostic skills had gotten amped up. And she said to me, "Do you do any long-distance healing?" I said, "No." She said, "Why not?" I said, "Well, I've got the patient right there, and it seems a little funky to me." And she said, she explained what she did, and she said, after she explained it, I said, "I did learn how to diagnose long distance years ago at one of my TBM seminars. There was a doctor from Florida who had a technique for diagnosing long distance." Now it sounds crazy. So she said to me, "I want you to do 2 patients this week, long distance." I said, "Okay, we'll do it." And so one of my first patients that morning was Mark, and when he came in, I said, "Do you mind," after I adjusted him, I said, "Do you mind if I use you as a surrogate to do long distance testing?" He said, "No, I don't mind." So what I did was, and I learned, I followed what this doctor in Florida did, and it coincided with something that I had learned in India, which I'm going to explain to you now. It's called name and form. In Sanskrit, it's called nam and rup, name and form. And thousands of years ago, a great sage by the name of Patanjali taught the Yoga Sutras. Sutra means a thread, so the thread of yoga. And he taught how to develop what's called siddhis, S-I-D-D-H-I-S. It means supernormal abilities or supernormal powers. We know that there are people in society who are clairvoyant. They're clairaudient. They could see at a long distance. They could hear at a long distance. Sometimes we've heard about people levitating. Well, Patanjali taught how to do that if you can go deep in meditation. It's called name and form. So I had studied with Maharishi Mahesh Yogi, and he was teaching us how to do these siddhis. And he would come around to our hotel in Switzerland in the evening and ask us what were our experiences that day. And people would raise their hand, he'd call them, and he said, I could see, one would say, I did the technique for long distance vision, and I could see that the Swiss hide their armaments on the other side of that lake in the mountain. People were having experiences like that. And we were all learning to try and levitate. And we would actually, when we would get really deep inside, we would actually pop up off the surface and come back down again. We'd pop up and come back down as the body would raise up. So I took that knowledge and I applied it to Dr. Frank's allergy technique, because I was probably the only person who knew Dr. Frank's allergy technique and had studied the Yoga Sutras. So it was natural for me to put these two pieces of information together. And I expanded on his allergy technique. He taught us how we could fix 3 allergens at a time. And then with this knowledge from Patanjali's Yoga Sutras, I figured out how we could do them all at once. So now, as some of you know, in the office, we do all your allergies at once. We do categories. We'll do all foods, or we'll do all airbornes. And usually the result is pretty quick, and if it holds, then you don't have the allergy. And sometimes we have to do it a few times. So using this whole idea of name and form, I realized how this fellow from Florida did this long distance healing. He would write the name of the person who was in the waiting room, and he'd put it up on his chart, and he would muscle test his associate, and he'd run down the chart, and it's a problem with kidney, liver, spleen, gallbladder, et cetera, and he'd be muscle testing his associate all that while. And when he got to a place where there's a problem in that person, the arm would drop. Because the muscle testing, it's not just a physical event. You see, if I said to you, how much ATP are you producing in your thigh right now to have energy? You probably wouldn't know, right? Anybody know how much they're producing in their thigh now? No, nobody knows. How much hydrochloric acid are you producing in your stomach? You don't know, because you're not doing it. The body is running on automatic. There's this, I think we'd all agree, there's this underlying intelligence that runs the body. Would you agree? Like, if your body wants to vomit, it's going to vomit. You've got nothing to say about it. Or if it needs to go pee, you're going to go pee. You have nothing to say about it. You better get to a bathroom or you're going to be embarrassed. That's the way it is. This body is running on automatic. There's thousands of processes going on right now, just as we're speaking and listening, that you have no control over. If you had control, then you could stop your nails from growing. Or you could stop your hair from growing, but you can't, because you're not doing it. When we do muscle testing, we're communicating, our individual consciousness is communicating with the underlying universal consciousness that runs the body. And so, while I may be touching points on your body and testing, you have no idea what I'm doing. But the arm is going strong or the arm is going weak, because it's that underlying consciousness that's telling me, yeah, this person has a problem in the stomach. This person has a problem in their kidney. Then we do something, a treatment for it, and then we muscle test it. And if we did something good, then the muscle should be strong, if we helped it. And that's how muscle testing works, and then we're going to teach you how to do that. So when I did this first long distance healing testing with Mark, I used, my secretary was at the front desk, and I used Mark as a surrogate. And we put Marie's name up on the chart, and we started testing. That's me letting that universal knowledge know I'm testing Marie. Tell me how Marie is doing. And I go down the chart, and when I got to hiatal hernia, boom, the arm goes weak. And I said to Mark, I said, do you have a hiatal hernia? He said, not that I know of. So I tested him for hiatal hernia. None. Then when I tested him on the chart, we go weak. So I called Marie in. I said, Marie, how's your digestion? You have acid reflux? She said, I do. How did you know? I said, because I was just doing some testing on you while you were sitting at the front desk. She says, oh, okay. Now she thought that was a little weird. I said, would you like to fix it? She said, of course. So what I did was, I took her name and I put it on Mark. I laid Mark on the table and I had her stand over by my desk. And I adjusted Mark for hiatal hernia, and as I did that, she said, my stomach just went kerplunk, because we're pulling the stomach down, while she's standing by the desk. And Mark and I looked at each other and go, oh my God. So I realized I was onto something. Well, then after Marie went back to the front desk, we called up his wife, Patty. And he told me that Patty had a problem with her right knee. So I wrote Patty Gebertstein on a piece of paper. I put it on Mark, and I tested the right knee. It was strong. When I tested the left knee, it went weak. I said, I think she has a problem with her left knee. Let's call her up. So we called Patty up, and sure enough, he says, which knee is bothering you? She says, my left. He says, that's what Doc said. Okay, Patty, do you want us to do something to help you? She said, sure. So we did a treatment on her knee through Mark. Now I said, go ahead, get up and down and jump around. How's that feel? And she says, feels much better. So I realized I had figured out how this stuff worked. So I went and looked up long distance healing, and sure enough, it's all over the National Institutes of Health. There's articles about it. And basically they say, we know there are thousands of long distance healers all over the United States and the UK. It's just that we don't know how it works. So I think I know how it works. Maybe I'm wrong, but whatever it is, we're doing it, and we do a bunch of these every week. We have people all over the country that we treat on FaceTime. And if we have anybody here, we might do a long distance treatment here by treating somebody in the room in a few minutes for one of your problems. So if we find somebody with a leg length deficiency, then we'll show you how to fix the leg length, and we'll show you how to fix it long distance too. I know, it sounds crazy, right? Until you see it, until you experience it. So that's a little bit of an introduction. It may be too much for some of you people to grok, but when you see it or have it happen to you, you're going to say, it sounds crazy, it was crazy, but my headache is gone. Okay. So let's start out learning some basic muscle testing. Okay? I'm going to use Kim as a demonstration model, and I'm going to show you how I do it. Then I'm going to ask you all to pair off and practice it, and it's easy. Okay? So Kim, why don't you stand right here and face this way. Give me, is this good, Stephania? Come over here this way. Hold this like this. I'm pressing down. So what I'm going to do is I'm going to hold her arm out full length, and I'm going to press on the wrist. Now, I'm not going to use my full strength because she's a woman and she's probably not as strong as a big burly man, so you have to adapt your testing technique. So I'm just going to stabilize on her shoulder, and I'm going to say hold, and after I say hold, I'm going to give her about a half a second, and then I'm going to press. I'm not going to start pressing before I say hold because this is not a wrestling match. We want to give her a chance to respond, so we see if there's a strong response. So I'm going to say hold, and it's strong. Hold, good. That's all I have to do. Now I know what strong feels like with her. Then I'm going to do what I call the swipe test. And I'm going to swipe down. She has 14 major acupuncture meridians running through her body. I'm going to take the one that runs from the top of the pubic bone up to the forehead. This electrical energy is running this way. There's also a magnetic field that's attached to it. Anytime you have magnetism, electricity, you have magnetism. Electromagnetism are two sides of the same coin. So I'm going to swipe down against that magnetic field. It's flowing upwards. I'm going to swipe against it. It's going to mess it up, and it's going to make her temporarily weak. So hold this real strong for me now, and hold. And she's got nothing. If I fix it, hold. It's strong. That's all it takes to find out if that body is responding. So now I know her body's talking to me. So now I could go on and do whatever testing I want to do. So one of the things about muscle testing is you have to pay attention. If I'm in my office and I'm muscle testing somebody and I see a car go by and I'm watching it, all of a sudden my tests go haywire because my attention wasn't on what I'm doing. My consciousness wasn't focused on what I'm doing, and the answers go out the window. So what I like to do is I always like to double check myself because I want to make sure I'm getting accurate information. So I usually will start out, before I start out checking somebody's neck or checking somebody's back or their hips, I'm going to do my swipe test and make sure, yeah, okay, that body's talking to me, great. Now I can go ahead and start testing. So what I like to do with you all is have you all pair off and practice on each other for a few minutes till you feel comfortable with muscle testing. Okay? Okay, why don't you two pair off and why don't you two pair off?
Okay.
So remember, the procedure is stabilize on the shoulder with one hand and then have the person hold the arm out, and as they're holding their arm out, you give them a moment and then you say hold, and then you wait about a half a second and you press till you feel it locked. Do not stop when you feel a little resistance. Go right through the resistance for a moment so you really feel it lock, as opposed to backing off and not really giving it a full test. Okay, why don't you pair off and I'll...
You want to go first? Sure. So I'll do you guys okay. All right. To hold, right? Okay. Hold up first. And then you want to do this arm or this arm?
Hold this arm.
This arm? Yeah.
Okay, a little bit.
Good. And all you do is press for about a half a second. When you feel it locked, then you're done. If you just bounce off, then you make, if it's weak, and when you swipe down, it should be weak. When you feel it weak, then you just go right through the arm.
So you try again. So, and then swipe down. Hold. And try. Hold.
She's strong both.
You gotta say hold first.
Okay, so I'm gonna do it.
Swipe down.
That was good. Okay.
That's it. You feel the difference? Yeah. Now fix it. Swipe up.
Okay. Face on my, oh, like up or?
Doesn't matter. Just sweep up.
Okay. Well, you get your money.
Yeah.
That's it.
Okay.
You got it already.
I want to feel.
Okay, so I'm doing what? It's the right
Which,
one.
she's strong both ways.
So,
Did you swipe down?
Yeah.
Go ahead.
hold. Like, give me some resistance.
Okay.
Hold.
Swipe down first. No. Come right here. Go right down
here,
here.
see?
Yeah.
Let me try to, hold on, let me reverse it.
Oh, that's different.
Oh.
It was because I started too low?
I don't know.
It's because you were here.
No, it isn't. Go ahead, try it again. Fix her. Swipe up, fix her.
Gonna swipe up. Okay.
Okay.
Good. Now swipe down.
Swipe down.
She's trying really hard.
Well, she should. She should.
Okay. Yeah.
I'll swipe back.
Swipe up. Make sure it's fixed. But get closer to her. Get in right here.
Okay.
That's it.
So when I swipe up, it's
Now swipe down.
Yeah, swipe down, then where it's weak.
She's weaker, I can tell, because she's trying harder to keep it straight.
Here, let me try. Let's see.
Oh, I was going to crush me.
You want to use the other arm or that arm?
Whichever.
Okay, let's.
You like this one?
Left-handed, which is why.
I
Okay.
am too. So now it makes sense to me why you're doing it that
So
way.
you hold real strong. Hold. No.
I think too, because he's making contact.
He is making
So he's really
I'm
making sure
I'm
to
closer.
disrupt the.
Okay.
Swipe up. Make sure she's strong. Get closer in. Get closer in.
Okay.
Yeah, that's it. And right. No, not out here.
Okay.
Right down here.
Do you want me to take my glasses off, or
No,
you
it
want
doesn't
I
me
matter.
think it's sort of like the idea of brushing against.
You don't have to touch her, but she'll be right next to her body.
Okay.
And down.
Okay, there's a difference there.
Yeah. Okay.
Okay.
Got
Too
it?
far off there.
Now, did you try her yet?
No, not yet.
Okay. Then you guys switch.
You want to hold out your.
You got it?
yes, I got it.
Easy, isn't it?
Yeah, it's easier.
Yeah.
On the
So
little,
hold
how
strong?
you feel the weakness.
Yeah.
When you swipe down, right?
Whenever we get go for it again. So hold strong. Okay. And then I'm going down, correct?
Down.
Yeah.
Let's hold it. You got to say hold. You
Oh,
can't
okay,
just
sorry.
you can't just touch her arm and then start pressing
Okay.
because you need to give her a little
Gotcha.
notice.
Okay, so.
You say hold
fix
and
it.
Fix it.
Okay, so hold.
No, you didn't say hold.
Oh.
You got to say
gotta
hold.
say
You got to
for
tell her
both.
when you're going to do it.
Okay.
Okay, fix her again.
Okay.
That's it.
Okay, so, okay, hold,
Good. Now swipe down. Tell her hold.
hold,
There you go.
okay,
You give her a chance.
hold. Hold, okay.
Good.
All right.
Now, when you get somebody, now you might adapt your technique just a little bit. If you get a big, burly 6'6" man, you may want to have all of your hand on his wrist like that. And for a kid, a 10-year-old kid, you might just want to use a finger like this.
So you
Hold.
wrap around the wrist.
I do, yeah,
Okay.
I do. I don't like this as much because I'm using my smaller muscles when I got my fingers here. I could have a lot of sensation, feel what I'm doing, as opposed to here, it's more in the arm. Here, it's also in the wrist and the fingers. A little more sensitivity. But that's how you do it. It's easy, right? Yeah, good.
You want to try with her so she can see your resistance and.
Sure.
Since-
Okay, you test me.
Okay. Hold. Hold. Yeah.
Okay. Now you got to fix them.
Oh, yeah.
Swipe 'em up.
Fix it.
That's it. Don't leave them
Don't leave me.
unzipped. Okay, good.
Okay.
Let's have a seat. Great. So that's easy, right?
Yes.
Now you just go home and practice this. Now what I like to do is I like to double check myself too, especially when I first started out, because I had some skepticism and some doubt about it. So you'll notice if you come in my office, when I first stand you up and test you, I'm going to press on the hip, and the hip is going to tell me if the leg, how the leg length is, if the leg length is even or if it's short on one side, because we're going to go right into, in a few minutes, learning how to fix back pain. So this will tie in this muscle test, because I always double check myself. I check the person standing up, and then I lay them down, I check the leg length. When we do the leg length check, we're going to have to go get our shoes, because it's really best to do it with your shoes on, because then it becomes really clear if there's a discrepancy or not. You with me? So let me talk a little bit about back pain, because that's the first thing we're going to start learning how to treat and fix. There's a number of reasons for back pain. Chiropractors are very famous for fixing back pain. Especially medical doctors hate back pain cases because they don't know what to do with it if they don't have to have a surgery case. If they can make surgery out of it, that's one thing, but if it's not a surgical case, well, they send you to a physical therapist or a chiropractor or tell you to take muscle relaxants. But let's understand the anatomy of the back, and this is going to be really important, because if you have this knowledge, later on in life, you may end up saving yourself from surgery. You may be able to make the differentiation between needing surgery and not needing surgery. If we took 100 people off the street who didn't have any back pain, and we did an MRI on them, we studied their back with an MRI, we'd find about 30% of them have bulging discs in their low back. That's a lot. But they don't have any pain. So what that means is, a lot of bulging discs do not cause back pain. But people do get back pain, so some of the times that back pain is not going to be from a bulging disc, even though they have it. Does that make sense? Because you got 30% of the people having bulging discs on MRI, but no back pain or no sciatic pain, pain down the leg. So what are the other causes? Well, of course you have the vertebra rotating out of position, pressing on a nerve, causing back pain. Or you have what we call the facets pressing on a nerve, causing back pain and or sciatic pain. And I find it frequently. And what facets are is, let me show this. Can you see this well?
Yes.
The spine has 24 vertebrae, and they're held apart by these white discs. As you get older, everybody's heard of people getting shorter as they get older, right? The reason they get shorter is because some of the water comes out of the discs. And if the water comes out of the discs, even 1 or 2 millimeters through all the spine, you're going to go down about an inch. So what happens is those discs hold the vertebrae apart. These two prongs, can you see this well? These two prongs are called facets. You have, this is the big bone, the sacrum, and here are the hip bones. Here are the facets on the sacrum. These are called the superior facets. Here's the inferior facets of the fifth lumbar. The fifth lumbar has 2 superior facets also that glide onto the inferior facets of the fourth lumbar. So there's 2 pairs of facets on each vertebrae. And you can see these facets here, the nerve root comes out just near the facet. If the facet is riding up too high, it can pinch on a nerve. That's called a pinched nerve or a subluxation. So what we want to do when we find facet syndrome, we want to separate the vertebrae or the sacrum from the vertebrae above it. We want to pull them apart. If you don't address this problem and you just go right to surgery, frequently you end up with a diagnostic code of failed low back surgery syndrome. There's actually an insurance code for it. Failed low back surgery syndrome, because the surgery was done for the wrong reason. And then they come out of the surgery and they still got pain. So the facets have to be brought down. Sometimes these facets grow in here and they have to be shaved off. There's nothing you can do. They just have to be surgically shaved. But frequently it doesn't have to happen. So I have a lot of patients that come in my office with back pain who have a positive MRI, and yet when I test them, when I do the muscle test, which I'm going to teach you in a moment, it shows up that they got facet syndrome. So those patients, we just pull the facets down and they don't need the surgery almost all the time. I think in the last 12, 13 years, I've had 2 patients go to surgery for back pain because the disc was bulging and pressing on the nerve root, and it wasn't moving the facets. That didn't help. But probably 90% of the cases that come in with facet syndrome improve greatly, sometimes quickly, sometimes, and usually I'll ask them right after the adjustment, get up and walk around, see how that feels. And frequently, oh, that feels so much better, because you take the pressure off the nerve root. Those patients can't sit very well, because sitting in this position causes compression of the facets and the discs. So we tell them to recline. Put the weight on the shoulder blades. When you take your meal, sit in a chaise lounge or a lazy boy, or when you're watching TV, because that'll take the pressure off the discs and you put it more on the shoulder blades, and so it doesn't compress. Then what we do is we have them ice it down, because the nerve root's inflamed. The opposite of inflammation is ice. If they've been heating it up, they're just adding to the problem. So we have them ice it down, we pull the facets apart, and usually these cases resolve. Sometimes they take some maintenance. You know, maybe it takes once a month maintenance to maintain them, but usually those people do pretty well. So that's facet syndrome. Another type of back pain is caused due to the hips being out of position. So a common area for back pain is in the low back and in the sacroiliac joint. The sacroiliac joint is this joint right here between the sacrum and the hip bone. This joint is held together exclusively by ligaments. So if you were riding your bicycle and fell down and landed on your butt, this hip might go like this. Remember, the femur head, the thigh bone fits right in here. So if you landed on your hip, or you're wearing a big wallet in your back pocket and the hip goes like that, that means that the femur head goes north. Well, the leg goes north also. So that's going to produce a short right leg on that side. So when I lay somebody on the table, I check the leg length. If they have a short leg, I know that the hips have more than likely gone this way. And I got to fix that, because that will cause pain right here in the top of your butt. Maybe an inch or two off the midline. You'll have back pain, sciatic pain, sacroiliac pain. So the ligaments go like this. They go in an X fashion. They go like this and they go like this. So when this hip goes like that, some of the ligaments relax and some of the ligaments get stretched. The ligaments get stretched, get inflamed, and they hurt. In addition, when this does happen, and this is just simple basic anatomy, we all have an inguinal ligament that runs from the pubic bone up to your hip pointer. It runs like this here on either side. When this hip goes like this, these inguinal ligaments can get stretched and you can get groin pain. So the same adjustment fixes the sacroiliac joint as the groin pain. So we're going to show you how to fix it for a short right and for a short left leg. And we're going to use this device called the pelvic balancer. This is a device I invented about 12 years ago, and we didn't have anything in the chiropractic profession for the patient to do at home to help themselves. And so I had these blocks that I used for a certain technique, and I had this fellow come in with sacroiliac joint pain, and we would put the blocks on him, let him lay on the blocks a certain way, and he would feel better. But I wanted to see him a couple of times a week, but he said, I can't do that. I go to a different courthouse every day throughout Texas doing some tax work. We can't have a different chiropractor 3 times a week. So I said to him, why don't I loan you a couple of blocks? You can block yourself when you're out in another city. And by that time, he had kind of gotten discouraged because I would adjust him on Monday, and by Wednesday he was hurting again. And we did that for several weeks. He got discouraged, and he says, "Now I'm not interested." I said, "Okay." So I tried to do it to myself, because I know sometimes I get a short right leg. I tried to do it to myself. I couldn't do it to myself. I couldn't block myself properly, because in order to see where to put the blocks, you had to be looking down from here. And I haven't got that technique fixed out yet, where I can be in 2 places at one time. So it didn't work. So then I started fooling around with making the blocks on other pieces of foam, and then I ended up coming up with this solution to it. So I think what I like to do is I like to test all of you, see what your leg length is like, and treat it today if you'd like to have it treated. I know I've done yours, Sinra, and I've done yours, Kim, and yours also. And you don't usually get a short right leg? Mm-hmm. Yeah. So I want to teach you how to do this, but for this you're going to have to put on your shoes. So can you go get your shoes? Maybe all of you should go just have your shoes handy, and we'll put them on for the test. And if at home, if you're watching this at home and you have somebody with you, I'm going to show you how to do the leg length test, and your child or your spouse or whoever, your friend, can do the check with you, and you'll know if you need to be blocked. So why don't you put your shoes on, and we're going to come over here on this table. And when you lie down, this is a long table, put your hands on your forehead. So when you do this at home, do this on your bed and have your hands on your forehead so you don't have to turn your head, because if you turn your head during the test, you could change the length of the legs. We don't want to do that. So I know Sarah, okay, so this is a perfect case because Sarah has a short right leg. And when she goes out, that's how she goes. So what I do is, to do the check, I pull down on both of her legs, take out any slack, and I take my thumb and I put it under the shoe, and you ought to come right here if you could. Put it under the shoe and square off the feet. And if you come right over this, you can see it's a short right leg. Why don't you all come over here and look at this? See how that is?
Yeah.
Can you see that? Short right. Okay. Now, stay just like that, Sarah. Remember we talked about doing it long distance? We could either fix it directly now or we could do it long distance by treating somebody else. You want to see it? Okay. You saw that she has a short right leg, right? I'm going to use Kim, and we're going to have her on this table here. And so we're going to write Sarah. It's F-O-H-L, right? I'm going to write Sarah, F-O-H-L. I'm telling the universe we're treating Sarah. So, better take your glasses off. Come in. I need to put this on you. Okay. You can put it down a little bit. So get up on all fours on the table. Now we're going to block Kim. Go ahead and lie down first. Okay. Now, come on up on all fours. Because Sarah has a short right leg, I'm going to angle this. Actually, let's use this one, because this is the one you'll use at home. There's only two ways you can use it. When you square it up to your bed, it's either this way, a high left block, or a high right block. So we're going to do a high left this way for Kim's short right leg. So you go ahead and lay down on that. Hang on. Okay, and down. Good. Did you feel anything in your hip, Sarah?
I think so.
Huh?
A little.
What did you feel?
Just like.
I want you to look at her leg length. It's even. Am I right? Can you see that? It went from a short right to now it's even.
Wow, you're right.
Is that wild?
Yeah.
Okay. Come on up, Kim. And down. So what happened was, we told the universe we're adjusting Sarah. She could have been in Tucson, Arizona. Same thing would have happened. Now, look at the leg length. The leg length is dead even, which is what we wanted to happen because we blocked it for a short right. And if you come right down here, you see it. Yeah. And that's how you do long distance. You let the universe know, I'm treating so-and-so. Okay, come on up. So Sarah, what did you feel when I put Kim on the block?
I just felt some movement. I don't know what I felt exactly.
You felt in the hip?
Yeah.
Yeah. Mm-hmm. So that's how we do the pelvic, we call that pelvic obliquity, or imbalance in the leg length. And if you have imbalance in the leg length, invariably it's going to lead to back pain. It could be a knee pain, an ankle pain, a hip pain, a low back pain, because it means that you're bearing your weight improperly. If you have a short right leg because the leg went like this, you're going to lean to one side. And then if you walk a lot or you run a lot, you're going to be putting more weight on this side than you are the other side. And things are going to get out of balance and they're going to start hurting. So that's how you can do it. And if you have the pelvic balance, you treat the short left just the opposite way. Let's try, should we take a look at you? Let's just see how you look. Leave your shoes on. So go ahead and lie face down. Do you know if you have a leg length imbalance?
I think in the past, yes, but I don't know.
Yeah, so look at this. So this is a short right. Again. Can you see it? So what I do is I pull down the legs, square up the heels. Everybody has one or both feet that turn in. So this way you don't get a very good idea of the leg length and balance, but you have to square up the heels. And then you get to see. She's got about an inch short on the right. So we would block her the same way. Come on up on all fours. Why don't I let you do it? Okay? Come on up on all fours. That's it, you got it right. Now, is her hip on it? The hip pointer?
Oh, yeah. So make sure the point of your hip is on this one.
Yeah, so you got it. Yeah, so it's got. That's it. Okay. Now, let's look at the leg length again. How does it look? Nice and even. It moved the hips. So we used her weight and her breathing, and it adjusted itself. Good. Now, come on up. What you want to do next is you want to take the device out, and then have him lay down again, and see, is it still even? And it is. Then what I would do, come on up, it's Hilda, right? Come on up. Let's walk around the room a little bit. So now we're going to stress the hip joint for a minute or 30 seconds. Just take a walk around the room. And then we lay it back down again. And is it still holding? If it's still holding, good, we're done. If it's not, we block it again. Okay, let's go face down. That's it, and put your hands on your forehead. Good. And there it is. That's staying. That's nice and even. See that? That's just what we want. Perfect. Easy peasy. Good, come on up. Then, and you can see you only have to do it for a couple of seconds. 10 seconds is all you need. Thanks, Kim. So, let's say it's your husband or your wife that has the hip imbalance. Block them. Have them walk around. You could check them later in the day. Is it still holding? If it's still holding, great. If it's not, block it again. You only have to do it for 10 seconds. So you can do it 2-3 times a day. You might have to do it 2-3 times a day for a week or two before it finally stays. Now, I'll tell you a little trick that I use in my office, that if after 4 or 5 visits it's not holding, usually I won't sell them the device the first visit or 2 or 3, because I want to see if it's going to hold, because they may not need it. If after 4 or 5 visits it doesn't hold, I say, you know what, why don't you buy this, do it yourself at home, you'll save yourself a lot of time and a lot of money. Then when they come back, I check them. If they're blocking a couple of times a day and it's still coming up periodically a short right, then I'll have them do an exercise at home called the 1-shoe walk. And the 1-shoe walk means I want to simulate a short leg on the opposite side. So, like Hilda had a short right. If after a few days or a week of doing the pelvic balance at home, it still would not stay, then I'd have her take off her right shoe and just wear her left shoe and walk around for about 20 minutes. Just wearing the right shoe. I'm sorry. You want to simulate a short leg on the opposite side. So if she had a short right, she would wear the right shoe and we'd simulate a short left. And so for maybe 20 minutes a day, walking around that way. So you might want to write that down. If it's a short right and it's not holding, wear just the right shoe. I don't like to use heel lifts to balance out the leg length. I think it's cheating. Unless they broke their leg, unless they have an anatomically short leg from a fracture, I don't use heel lifts, because it still means that the hips are out of place. Even if you put a heel lift in the shoe, it makes the legs look the same length, but the hips are still out and the sacroiliac joint is still going to be hurting. Yeah.
You said wear just the left?
If you have a short right leg, wear just the right shoe. And don't wear a shoe on the left.
Oh, okay.
So you simulate a short left leg. And that sort of helps throw it back the other way a little bit. Or vice versa. If you have a short left leg, walk around for 20 minutes just wearing the left shoe. Are there any questions online that we should be answering? Any questions about this?
Not at the moment.
Okay, great. So that's, in a nutshell, how you can deal with back pain. Now, if the facets are jamming, there's nothing you're going to be able to do about it. You're going to have to bring it to a chiropractor. And he has to be somebody who's versed in doing a facet adjustment. Or he has one of those traction tables where they traction you out and you stay on there for like 15 minutes, it keeps pulling the vertebrae apart. It would have to be that type of treatment for facet syndrome. Now, I'm going to teach you the muscle test for facet syndrome, how you would do it. So I'm going to do it on Kim. And by the way, 20-year-old people, they don't get facet syndrome. Their discs are too full. It only happens after you're 35, 40, 50 years old, as the discs start to narrow. So unless there's been an injury to somebody, a younger person, they're not going to have a degenerated fifth lumbar or fifth lumbar disc or the fourth lumbar disc. It's not going to be deteriorated. It's very rare. It's mostly in older people. So face this way. What I'm going to do is I'm going to do a muscle test with her. Now, if I want to know if the facets are jamming, I just come here in the area of the sacrum and the fifth lumbar, and I just squeeze together and I muscle test. And she doesn't have it because she doesn't have facet syndrome. But if she did have it, when I squeeze here, it would go weak. Okay?
I do usually have it.
Yeah, you don't have it today.
Good.
Yeah. Okay, thanks. So that's how you would distinguish if they have facet syndrome. And the other way you would know about if there's a disc involved, and this is just general question that you should be able to have for yourself and your family. Does it hurt when you cough and sneeze and laugh or strain at the stool? If those produces sharp stabbing pain, then there's a chance that you have a disc bulge, that there's a disc pressing on a nerve. Laughing, coughing, straining, or sneezing, producing sharp stabbing back pain and or sciatic pain is an indication that you may have a disc involved. An indication that you don't have a disc involved means if you don't have pain on coughing and sneezing and laughing and straining, this is called Valsalva's maneuver, just for being technically correct. Valsalva, he must have been the guy that figured it out. So if you don't have Valsalva and you have a relief of pain when you bring your knees up to your chest or when you get in the fetal position, what you're doing is you're pulling the facets down. So if that causes relief of pain, then probably I would lean towards a facet syndrome as opposed to a disc, even if you have a disc bulge. So you would want to try somebody who does facets, a facet syndrome case, before you'd want to go to surgery. Is that clear? Yeah. So bringing the knees to the chest is common with facet syndrome. It relieves the pain. Also, a common sign is the person would rather stand than sit. Frequently sitting aggravates that pain also because you're compressing. So any questions about the low back and the sacroiliac joint? So remember, you block it and then check it, and if you have to block it again, you could block it 2, 3, 4 times a day if you need to.
When I'm sitting down, I don't wanna say long, more than 1 hour or two, but when I stand up and keep walking, I feel or hear a click here.
That's okay, the spine is meant to move. You should, I'm sorry?
Can you repeat what she said?
She said that when she gets up, she feels a click after she's sitting for an hour or two. And the spine is meant to move. That's not a problem. If things hurt, that's a problem. Yeah. Movement of the spine, sometimes you'll move your head, you move your neck, you'll hear a click. That's just the bones moving. And what that is the fluid in the joint moving. Just like when you pull on your knuckle. When you do that and you hear that crack, that's just the fluid in the joint moving. It's not the bones rubbing against each other. Yeah.
Is Facet syndrome something that can ever be fully prevented, or once you start getting it, will you just probably always be dealing with it?
You'll probably always have a weakness in that area. So if you have Facet syndrome, horseback riding wouldn't be a good sport for you. You know, or falling down playing volleyball wouldn't be a good sport for you because you're going to tend to compress. Yeah, but it can be managed, and it doesn't have to be painful anymore. You just have to manage it properly. And it means pulling the facets apart. Okay. So should we take a 5-minute break now? Bathroom break and then come back? Let's do that. How do you think it's going?
I love it. Yeah, it's going great.
Let's do headaches. Headaches is real common. Are we on, Estefania? Okay. So we're going to start doing headaches now. There are 8 consecutive acupressure points that you can use to get rid of a headache. And usually it's instant. It means within 10 seconds of doing these 8 consecutive points, the headache goes. In my office, you don't have to use this, but I use what's called a teishin. This is a non-piercing acupuncture needle. It's spring-loaded. The only reason, you can use a pen or a fork or your finger. It doesn't matter. It's just knowing the points. The reason I use this is it doesn't look so professional in my office if I use a fork. So I use the teishin. Sounds impressive, but you don't need to. So I'm going to go over the 8 consecutive points. And remember, you can use the end of a pen to do it. You can use any sort of blunt object. You don't need don't use the sharp end of the point. Use the dull end of the pen. So there are 8 consecutive points. I'm going to demonstrate them on Kim. So if you come on up. The first 2, everybody knows these 2 points. That right where the index finger and the thumb meet, right at that juncture. So you want to take your pen or the end of a spoon and you want to put it right in there and tap in there. All these are points about 5 to 8 seconds. You tap that point and you point it towards your elbow. So it's going to look like this. Five to 8 seconds. It doesn't matter which hand you start on. Do either hand. Anybody have a headache here today? No. Okay. Too bad. So we can take somebody's headache away. So we do both those points. Right there. Those are the first 2. 3 and 4 is going to be at the base of the skull, 1 to 1.5 inches off the midline. So if you feel under your skull, when you bring your head back, you feel a little groove, a little indentation off the midline. Those are on either side. Those are points number 3 and 4. So you just come in with our pen or our teishin, and we just tap in there.
The groove or the vertebra?
No, it's off the midline. So it's on in the indentation, in the groove.
Okay.
So it'll be right here, right there.
You should teach me, feel me how exactly is.
It's going to be.
Hurts in here.
It's going to be right here
Oh, okay.
and here. You'll feel a little groove at the under your skull, between your skull and your neck. So those are the first 4 points. 1, 2, and then 3, 4 on the side. Point number 5 is going to be, you're going to come from the tops of your ears right up to the midline, right in the middle, right in the crown of your head. There's another point up there that we're going to find, and we're going to tap on it. Again, 5 to 8 seconds. That's point number 5. Point number 6 is right between the eyes, right where you would call it the third eye. So we come in here. Can you see this? Keep your eyes closed. Right in there. Point number 6, right here. Point number 7 is going to be at the hairline, or where the hairline was, in my case, like right here. So with Kim, it's going to be right here. Again, 5 to 8 seconds. And this is in this sequence. You want to keep the sequence. 1, 2, 3, 4, 5, 6, 7, 8 is going to be at the base of the skull, right in the midline. So you feel the bottom of the skull, where the skull meets the neck, right in the middle, and you go in there, again, 5 to 8 seconds. You do those points, then say to either on yourself, you could do this yourself, or to the person that you're treating, how does that feel? Frequently they'll say, my headache's gone, or it's almost gone. Then what you do is you say, where is it left? And maybe they say, I still feel it here. So if they feel it on one side, you go around those points with your tool, but you do it on both sides. So it would look like this. If Kim says she still had some headache pain here, I would go around it, make a circle for 5 to 8 seconds, and hit these. It's called the ashi points, or circle the dragon. Hit those, then I do it on the opposite side. And that's it. That's how you get rid of a headache. Now, understand, that's not going to fix chronic headaches. If somebody's getting a headache 2-3 days a week, this is going to take it away. It's probably going to come back because there's another reason. And the reason with tension headaches, which is what most headaches are, is under the skull, you're going to find trigger points. So if I feel the base of her skull and I press under here, and you can do it on yourselves, press under here, there's from under the ear, close to the ear, to the midline, there'll be about 4 places to press. And you ask, is this tender? Is this tender?
Yes.
It is. So you hold it. It's not that I don't like him, but you want to hold it, and this is lactic acid in the muscle. How about here?
Mm-hmm, yes.
Here?
Yes.
And here?
No.
No. So 3 of those 4 points were tender. So if you feel under the base of your skull, you'll feel tender points from just behind the ear to the midline. Those have to be pressed out, because what's happening is those trigger points are in the muscle, and it's pulling on the skull. And when it pulls on the skull changes shape. And then the nerve fibers on the inside of the skull fire off, and that's called a headache. That's what a tension headache is. So first get rid of the headache with the points here, and then if it's on yourself, find these points and put your thumb in there and press on them every day until you could press and it doesn't hurt. If it hurts, it means you got trigger points in there. Any questions? Okay, thanks. So that's a really great way to get rid of headaches. And for you practitioners, when somebody comes in with neck pain, I'll frequently ask, do you also get headaches? And they will say, not often. And I'll say, how often? They'll say, 2 or 3 times a week. That's often. If I get a headache once every 6 months, okay, I'm satisfied with that. But if I get a headache every month or every week, there's something wrong. They shouldn't be getting headaches. I had a question?
Yes, last week I had a headache, but it was not like usual. Sometimes I get a headache like on the back, like here. And last week I had it like here. I don't know what's the difference between having pain on the back and on the right side.
Yeah, I don't want to get into diagnostic stuff here today. I just want to get into the refinements of the technique, how to treat it. But what I would do is I would do those points, and then regardless of where on your head you get it, sometimes and actually the question is a good question, because sometimes the headache or the point of pain will send pain somewhere else in your head. So you may find that when you press along here, you get pain over here. That means this is just a trigger point for your headache. But anyway, you want to press this stuff out. It's lactic acid. And you can use that not just on the base of your skull, but you can use that also along the muscles of the shoulder and neck, the trapezius muscles, or the muscles on the side of the neck. You'll have trigger points in those too. If you have that, you can press on those, and you'll know It's a little harder to do these on yourself than it is under the skull. But if you've had a massage and she presses on the, especially here across the shoulders, most everybody has trigger points in those shoulders because their head is going up and down several hundred times a day and you're working these muscles. And lactic acid is a waste product of using up your oxygen in the muscle. You use up too much oxygen, you get lactic acid as a waste product. It ends up staying in there. It feels like a little marble. And so that's one of the reasons why people feel tight, because they've got these trigger points in there. So you can use your thumb to press those out, even on yourself, but especially under the skull, and maybe you get your husband or your boyfriend or somebody to press them out along here. I know that's a little harder for them to do. They don't want to usually do that. So that's how you can deal with headaches. It's not that great with migraines. It's probably 40 to 50% effective with migraines, but a lot of people have really severe tension headaches, and they're calling them migraines. Migraines is really when you see auras or you have vomiting or nausea with it, or you're seeing auras around objects. That's really a migraine. It's just a severe tension headache. You won't have that. So this will probably work for that. Okay. Let's go on. Let's talk about hemorrhoids. Hemorrhoids are actually really easy to treat, and there's 2 acupuncture points that I'm going to teach you that will cause the hemorrhoids to quit bleeding and to suck up. I remember when I first got in practice, I taught this man how to do this, and he came in a couple of days later, and he came into my office, and he was crying. I said, "What's the matter?" He said, "Well, you taught me how to do those hemorrhoid points." I said, "Yeah." I didn't. So? He said, "My dad had hemorrhoids all his adult life. And it was very embarrassing for him. I wish he had known this technique when he was alive, because my hemorrhoids were already fixed." It was really a very sad, dramatic story, but that's how fast it can work. And sometimes you'll do it, and it'll be in a day or 2 or 3 days. And that can be the end of it, or you can manage them that way. So here are the 2 points. Actually, one of the points is the same point from the headache technique. You come up to the tips of the earlobes. Right on the crown, you tap on that for 15 seconds. The second point is an acupuncture point on the left foot. And it's in between the ankle bone and the heel bone. You'll feel that soft spot on your left foot in between the ankle and the heel bone. That's the other point. Get in there and massage that for 15 seconds. Those 2 points, do those a few times a day. This is a technique I learned way back when in school from a Dr. Klayman. If you've been in a chiropractor's office who have the drop tables, you know how in my office you have that drop headpiece? That's called a Thompson headpiece. Dr. Klayman, when he came around, he taught us that. Just a little thing that you pick up here and there, and it's worked miraculously for a lot of people. So just those 2 points, a few times, 2 or 3 times a day, top of the head, and on the left foot in that soft space between the ankle and the heel bone. First point is up on top of the head. You come to the tips of the ears, come straight up to the top, and take your finger or your pen or your teishin, whatever, and tap that for 15 seconds. Then you come inside the left foot between the heel bone and the ankle bone. There's a soft spot in there. Get in there and work that spot also. It may be tender. 15 seconds, a couple times a day. Yes, exactly. Exactly.
And only in the left foot.
Left foot only, yes. Okay, let's talk about asthma. If you're is anybody in here an asthmatic? No. Okay. I wouldn't, we'll teach you this technique. I wouldn't give up your inhaler, because in case it blows out and you have an asthma attack, you want to have your medicine handy. But we can improve people's breathing usually instantly, certainly within a day, with this asthma technique. And here's how it works. I'm going to use Kim again. So the test is to place the hand on the clavicle. Okay? So I'm going to face Kim this way so the camera can see it. Put your hand on the clavicle, and then I'm just going to do my regular muscle test. Hold real strong. Good. She doesn't have it, so if she had asthma, that arm would drop. And then we test both sides. So we can do that side and we do this side. So those are good. You can use her hand or your own hand. Just put the hand flat on the clavicle. If that comes up weak, let's just have your arm drop. Okay, so it's weak. So what I do is now put your right hand here. We're going to set up a computer program. You know, this body is like a biocomputer. We're going to set up a computer program, and then we're going to run the program. So the treatment here is, we found out that she has asthma because it's on the left side and it's weak. We come to the pubic bone, which is going to be right there. The top of the pubic bone, when you touch that point, it should make the muscle go strong. When you do muscle testing, when you found a correction for something, the weak muscle becomes strong. So if she had asthma, this arm would go weak. I would touch on the pubic bone and it would go strong. Then while she's holding this hand here, I say take a finger from this left hand and put it right here. Okay. So we set up a pattern. First the hand here, second on the pubic bone, top of the pubic bone. Then I'm going to turn her around and we're going to come to L5 and we're going to tap on the fifth lumbar vertebrae. So let's have you stand this way. The way we find L5, and we're going to demonstrate in a minute how to find the different areas of the spine. If you feel the top of your hips and you come to the midline, that's L4. That's the fourth lumbar. So we're going to come down one below that, and that's L5. The fifth lumbar. Remember, there are 5 lumbars. So I find the top of the hips. I draw a line from the top of the hips to the midline. That's the fourth lumbar. I come down 1. That's the fifth lumbar. Now I'm going to take 2 fingers on either side of the fifth lumbar, and on 3 phases of inspiration, I'm going to tap. So the first phase is no breathing at all. She just relaxed. The second is inspiration, and then I'm going to tap again, and then expiration. So the first one is I'm going to do this. Now breathe in, out. Done.
Tap 3 times each.
Yeah. Normal breathing, inspiration, and expiration, while she's holding those 2 points. Now, face me. Now, let go of this one. Now, I want to see if I fixed it. If I did, this should be strong. And usually it is. If it isn't, I'll do it again. Maybe I missed the vertebrae. Actually, if you miss the vertebrae, it's going to be weak. So you always, you retest it. If it's strong, good. Then I check the other side. If it's weak on the other side, I do both sides. So then we would come here, take this away, hold that. Okay, let's say it goes weak. You put a hand here, flat hand, then touch the pubic bone right there, and I come on the back and I'll show it to you again. Again, L5, here's 4, here's 5. Breathe in, out, done.
Can you use the 2 fingers?
I use 2 fingers like that. Or you could even tap it this way, gently.
Okay.
But it has to be on the 3 phases of respiration. Normal breathing, inspiration, and expiration. And then, you come on and have a seat. Then you can just say to them, okay, take a breath. How does that feel? And frequently at that time they'll say, oh, I can take a fuller breath. Wild. But it's instant.
And this is one you can do long distance as well.
Huh?
This is one
Yes,
can do
you
long
can.
distance as well.
Yes, you can. Exactly. Exactly.
That question.
This is one that you can do long distance as well. Yes. And the neat thing about when you do these long distances, you're going to talk to that person right after you do it on them. Maybe like we have a gal we have several patients in Arizona. They're on FaceTime. And maybe we're treating their allergies. We'll do the allergy treatment on Kim, and then I'll say, okay, how does that feel? Okay, yeah, I'm starting to breathe again. It's usually that fast, certainly within 24 hours. Now the question is, does it hold? It's easy to fix, sometimes it's not so easy to hold. A lot of these organ adjustments like the asthma, a lot of times it does hold for quite a while. Any questions about that? Now that's, what we did was kind of a simple fix. It may be more complex. You just have to see how the person does. Or if it's you, show it to your husband and see how you do. It may be that there has to be other types of treatment that we do at the office, but this is something that is simple that frequently works. It may be we have to do something with the lungs, we may have to do something with the respiratory system. Yeah.
I feel like I've met multiple people who say they have asthma that's under control, meaning they don't have problems or it's not something that's in their way. Would you still attempt to treat it, or?
Good question. So Sarah's saying sometimes she meets people who have asthma under control. Would you still attempt to treat it? Depends if they want to keep taking the medication, because probably it's under control with the medication, right?
Or they're only using the inhaler when there's a random time that they get an attack or something?
Yeah.
Okay.
Up to them. I mean, if they want to get rid of it, you can do this on them and see how it is. And maybe you do it and it's good for 3 months, and then it blows out. Well, you can do it again. It's easy.
Because with asthma, is it usually a stress trigger or an environmental trigger or both? Or?
You know, is it usually a stress trigger or an environmental trigger?
Can you repeat that?
Is the asthma reoccurring, is that usually a stressor, a stress trigger, or an environmental trigger? Frequently, I find that you have to fix the asthma at the same time that you fix their allergies, because the allergies will cause the asthma to blow out. So usually if I have an asthmatic who has allergies, the allergy treatment is a little more complex. So I'll treat that the same time as the same day as I treat the asthma. If I can get the allergies to hold, then that won't blow out the asthma. If the allergy blows out, then sometimes it can blow out the asthma. Yes, good question. Yeah. But, you know, it's manageable. Any other questions? Okay, go ahead.
Yeah, I was gonna ask, is there a technique to help relieve pain on one shoulder? Because usually I feel like a pain on my right shoulder, like I feel like I drop it more than this one. And I had to do this to feel that relief.
We're going to show you something that you can do generally for shoulder pain. Again, I don't want to get into diagnosing it in here and what the relationship is between the shoulder and the neck and the shoulder and the posture and all that. But it's a good question, and it brings me into a little philosophical point that we could talk about for a moment now. There's another fellow by the name of Dr. Richard Bartlett studied with Dr. Viktor Frank around the same time I did, way back when sometime. And I took some seminars from him, and he teaches a seminar called Matrix Energetics. And, you know, all of us in the health field, we want to know how these things work. And sometimes we don't know how it works. I can't tell you why hitting those acupuncture points in that order takes away a headache. I can only tell you it takes away a headache. My acupuncture teacher taught it to me, and I'm teaching it to you. He didn't tell me why it works. I don't know if he knows why it works. But we just have to accept that it works and just enjoy. So this Dr. Bartlett studied with Dr. Frank around the same time I did, because he had a child with some asthmatic problems and breathing problems, and Dr. Frank fixed it. And in Dr. Bartlett's seminar, and this is for everybody to understand. And I was taught this by some old chiropractor way back when I was getting out of school. And he told us, he said, when you new doctors, when you go to the table to treat somebody, you're not just treating them with your hands. You're treating them with your head, and you're also treating them with your heart. In other words, your intention matters, is what he was telling us. And Dr. Bartlett's saying the same thing. Not only does it matter, but actually more from a physiological point of view, when you touch the person with two hands, like you do with a massage therapist, as a massage therapist says, you are in the matrix with that person. You're in their field. They're in your field. You're in there together. So what you think and what you intend at that point matters. Because from this point on, when a patient comes into my office and I've got both hands on them, I'm thinking about them getting well. I'm projecting my thoughts or my imagination on them getting well, getting rid of their asthma or getting rid of their headache or whatever it is. It's just I've done it so many times, I don't even have to think about it. I just know. I have the confidence I'm going to hit these points and the headache's going to go away. And that's why if you go to a doctor who doesn't ask you how you're doing after the treatment, it's because he's not so sure about what the outcome is going to be. I always ask, how do you feel after I do a treatment? Because I want to know, was the treatment successful? And frequently it'll be successful immediately or very quickly. And I'll have tests that I do. One of them is to ask the patient. The other ones, I may do a leg check again, or I may do a muscle test again to find out, how did I do? Did I do the right thing? Is this muscle test still weak? If it's still weak, I didn't do the right thing. You better go back and do something else. So it's like, it's very intuitive for a mother. When her kid is sick, she puts her hands on the kid and she holds him and cuddles him and tells me he's going to get better. And she's also projecting that onto the future of that kid. So when we're treating people, you want to project what you want to happen from this moment forward, and maybe you're hitting some acupuncture points for the headache. So you can borrow other healers' knowledge just by calling them in. Like maybe a great healer for you is Jesus. So you could be putting your hands on that person, doing the acupuncture points, and you could be thinking, okay, Jesus, let's heal this headache. Or one of the healers that I use is known as Danvantare. That's the aspect of the divine that does healing. Danvantare. So I might ask Danvantare, okay, let's heal this person's shoulder. Get some help. You don't have to tell the patient what you're doing. Just you're healing them. See, because in my view, there's just one healer. And like the Sonny and Cher song goes, it ain't me, babe. But I'm a good wire. I view myself as a good wire between that divine healing power and that body. So I want to bring that in. I want to use it. So you can use it. So remember, when if it's your husband who's got a headache, put two hands on his shoulders and then start doing the headache points. Or you hold him and start doing the headache points. You're in the matrix with him. And just think about, okay, let's heal this headache. And you watch, frequently it's going to go away. You'll be surprised. But we all have these abilities. Just have to use them and have to know how to use them. So, we all want a family. We can at least use it on our family members. If your kid will let you do it. So, next, we talked about how to do the headache points and the asthma points and the hemorrhoid points and the low back adjustment. Let's talk about knee pain. This is kind of a crazy one, but it works just about all the time. And does anybody here have knee pain? You do? Let's just try using her and see if it works on her as an example. Is it hurt when you get up and walk around?
Usually when I walk, it hurts here and also this bump that I don't know how I got it, but it hurts.
Well, let's do a check. Well, let's just see. So
You have that? I have these folks. They don't hurt.
let's put this over here. Hilda, you come on up here. So now I want you to stand, and it's your left knee.
Yes.
Okay. Put your left foot up on here. Give me this arm. So we're going to do a muscle test. Now, the basic muscle test is, we call it therapy localizing. If you want to know if there's a problem in a particular area, you therapy localize. If you want to know if there's a problem in the liver, you touch the liver and do the muscle test. The body will tell you either there is or isn't. So I want to know if there's a problem in her knee. So hold that really strong. That's it. I want you to put your hand on the knee. Put it right over here. That's it. Good. Hold real strong.
Oh,
Okay. So see what happens? So we therapy look. She goes so weak, I could do it with a pinky. Go ahead, hold your arm out. No, not your pinky, just your arm. Hold real strong. So she's got nothing. Now take your hand off the knee. Hold this real strong. Hold. So it locks. Now touch the knee. Bingo. Okay, so now we're going to do similar to what we did with the asthma technique. We're going to set up the computer. So I know the point that's going to make the arm go strong, if it works, is going to be the gallbladder point, which is on the right side, just under the nipple. Right in the midline, just under the nipple, and hold this. Now, while she's holding that point, I'm going to see if the gallbladder point is going to help her knee. So you hold, if she lets go of the knee, the whole thing's, no, if she lets go of her knee, the whole thing is off. We have to have her continue to hold the knee and then touch the point to set up the proper program. So you hold there, lift this elbow out of the way a little bit. I'm going to come under here, touch the gallbladder point, you hold that really strong. Hold. When I take my hand away, that happens. When I touch the gallbladder point, that happens. So now, while she's touching her knee, I'm touching on this hand. I'm saying, take a finger from this hand and put it right here.
Where's the gallbladder?
Right here.
Oh.
Right on the gallbladder point. Right. It's right under the nipple, on the chest, on the right side. Now, I need her to stay like this, because the computer program is set up now. And now I'm going to come behind her, and I'm going to hit the gallbladder point, which is on the 4th thoracic vertebrae. And I'm going to show you how to find it in a minute after I do it. So, whoops. Stay just the way you are. So I go to the bottom of the scapula, 7, 6, 5, 4. Breathe in. Out. Good. Take this hand away. Take this hand away. Hold this. Good. Now go take a little walk. And we'll see how the knee is. How does it feel?
Much better.
Much better.
Yeah, because usually when I walk, I feel like I put more weight on the left, and this part and this, I feel like it does this.
But it feels better now.
Yeah.
That's how fast these techniques work. Now, let me show you. Go ahead, thanks. Have a seat. Let me show you how to find the different vertebrae. So this was T4, okay? Yeah, I mean, these techniques, see what's cool is we did the same thing on Patty when she was on FaceTime, Mark's wife. We tested the knee, wasn't the right knee. We tested left knee, it went weak. And then we did that on Mark, and she felt it in her house. And then she jumped up and down and felt fine. So it felt as good as that. So I'm going to use Kim, and I'm going to show you how to find the vertebrae. So let's use you as a model. Yeah, could you?
You were that special.
Oh, yeah.
Okay, let's face this way. So remember, we just found L4. Remember, L4 is at the top of the hips. If you come to the top of the hips and come to the midline, that's L4. So I'm going to put an X here. Okay, that's L4. C7, remember the 7 cervicals, 12 thoracics, 5 lumbars. So in the 7th cervical, the big bump on the neck is C7. Just to give you a guideline of where we are. So I'm going to put an X right there.
On your show, unless you use a marker.
Huh? Do we have a magic marker? I
You didn't bring a sharp.
think it is. No.
They do at the front desk in Umbrella.
Could you? Yeah. It would be better with we use a Sharpie. So this is C7. L4. And now T7, the thoracic 7. If you have put your arm behind your back. Put this one on like this. It'll make the scapula stand out. So this is the bottom of the scapula. Okay, you can put your arm down. If we go from one scapula to the other, right in the middle, that's going to be T7. Like that. Great. Oh, well. You're going to have to take a good shower. Kim.
Obviously, I don't mind to get marked on.
So, here's T7, C7, and L4. Those are good markers, and you should be able to find your way around the spine when you got to find something. So now we want to find T4, because what we did on Hilda was T4. Okay, thanks.
And then that's under, like, where the class.
This is under the scapula. The base of the scapula, yes, is T7. So here's C7, here's T7. I wanted to find T4, so I go 7, about an inch between each one. 7, 1, 2, 3, 4. So T4 is going to be right about there. And here's 5, 6, and 7. Okay? So I came in here and I tapped on T4. Now, it was as perplexing. What happened to her?
You do the 2-finger again.
Yeah, or you can tap it. I tapped it like this.
Okay.
Thanks, Kim. So it was as perplexing to me as it was to you that her knee would feel better by me hitting T4. I remember years ago I said to Dr. Frank during the seminar, because he did the same demonstration. Took some guy, touched the knee, had him touch the gallbladder point, tapped on T4, and the guy walked away. His knee was feeling better. I said, why does that happen? What's the connection between the gallbladder and the knee? I didn't know. And he just said to me, he says, the gallbladder meridian, the acupuncture meridian, runs through the knee. That's why tapping on the gallbladder affects the gallbladder meridian and starts to heal the knee. Okay? Wild, huh? So let's do this. Let's have a little practice session. why don't you pair up and test each other's knees, or you can test another joint, like an elbow or a shoulder. Sometimes this will work with other joints. It almost always works with the knee. Okay, so let's pair up. Okay. You know, do you want to take a 5-minute bathroom break or no? You can, if you want, you can go to the bathroom or just pair up and start working.
Sure.
That was pretty neat, huh? So,
Hopefully it helps with this bump in here. It hurts.
so you will see. You might have to put a strap around that. So we're off now.
Let's check my lip.
Let's just
Okay.
For fun.
for fun. This
So
is just for fun.
So first we're gonna do holding it strong. So,
Stabilize on her.
okay, so
Yeah.
hold. Okay, and then put your hand on the knee. Okay, so she feels strong with that.
Okay.
So then would we check the,
Then check the other knee, just so you get the feeling of it.
okay? All right, so we'll do this again. So hold strong. Okay, now put your hand on the knee. Hold. Okay, a little weaker, but maybe it's because here, you want to try it one more time? So hold. Okay, that's strong.
Yeah, as soon as you
'Cause
feel.
I'm screwing up the muscle.
No, that's all right. No. This is why we're practicing. So as soon as you feel the strong resistance, then you're done. So let's put your foot up here. Put a hand on the knee. Let's just check. Hold real strong. Okay, done. I can feel. Hold. Good.
Good.
I don't want to. After I feel the strong lock, I don't want to lean on it because.
I think also it feels like you're going strong so that it's like there shouldn't be any weakness rather than just sort of pushing, but you're just sort of, you know what there's a difference between I'm going to push until I get weakness or
Okay.
just pushing.
Okay.
And that might be why, because
Okay.
I do that too.
Well, no, because
Okay.
when you, at the beginning, you said work, like don't stop when you get the resistance.
Right.
So I think in my mind, I'm like, well, I'm going to go through it.
No, when you feel it lock,
Then we're good.
you
You're-
press firm. See, I press firm in the beginning. Hold there. I'm pressing
So
firm,
You're just, as soon as
but
you-
it locks, so I'm done.
Okay.
Right.
Now, if I did it this way, hold.
Oh.
Hold real strong because I'm going to mess it up. Hold. So I could feel it can't lock.
So it's okay.
So I keep going until I feel the lock. I mean, because I did the swipe test. Why don't you work with Hilda?
Okay, so we were going to do something that you, I'm pretty sure you would be weak on, like your shoulder.
Well, I know you could try my hips, like he does, and
Okay.
that would definitely be weak.
So hold.
So,
Okay, so I felt it lock. And then, so I guess if you put your hand on your,
if I put my
Hip?
hand on my hip, yeah.
and hold.
Okay.
Yeah, okay, I can feel the difference now.
Yeah.
So I don't have to like gorilla grip.
Right.
Okay, fantastic.
You want to try again?
Should be
Is
good.
it- you feel it different?
Yeah.
We can try.
And then hold. Yeah, yeah, I can feel it now. And is it both sides or just the one
Oh,
side?
let's see.
Okay, so, do you want to do the other way so it's easier for you to, okay, so hold strong.
Now you
Okay.
need to
And then hand on that hip and hold.
hand watching
Okay,
yourself.
so,
Maybe
it's a little weaker, but the other side felt,
Super weak.
yes.
Okay.
So
How about
carry.
you? Check your.
Yeah, let's do it. All right, which one do you want to do?
It doesn't matter. So what are we gonna do?
We'll touch my shoulder. We'll touch my shoulder.
Your left knee, your left
Yeah,
knee.
we'll touch my shoulder. Yeah.
Hold. And you want
So I could hold.
yeah. There's a weak feel.
Yeah, yeah. So we'll try to set it. So,
Stay strong.
this one I think is, yeah.
See, that it's helpful to.
Actually, no, I use the same hand. I use the same, I touch the same, with the same hand, so now it's the right base, and then
It's like a rhythm.
Right, right. He makes it look so easy.
He does it like a million times. It's a song. Okay, hold.
Seven on this is six, five, four. And then I'll come in here and turn his head.
Okay, hold.
Break
A little
out.
weaker. Yeah. When you're strong, you're like, oh. You're like people.
I have like little kids hanging off my arms.
How's he going? How do you think?
It's going great.
I think my knees broke.
Make sure you announce it. Announce it whenever.
But when he was. Pain like in my sit bone. I'm gonna say that like it's kind of all on the same band. So,
Yeah.
Oh.
You You feel like you're getting the muscle testing down?
Yes.
Yeah?
Yeah.
You're starting to
yeah,
feel
all
it.
the difference,
Yeah.
Yeah.
It takes practice.
It takes practice.
Yeah.
Okay. So let's do another technique.
Doctor, you can't chew and talk.
Okay. At the same time.
So hyper. I'm getting so hyper.
Okay. Let's have a seat. Acid reflux affects 100 million Americans. So many people, Pfizer is not going to like this. So many people are taking these acid reflux meds, and acid reflux. You see how easy it was to fix her knee? I mean, that was easy, wasn't it?
Yes.
It took just a couple of minutes, and her knee feels better. We may have to do it again. But some of these things are so fast that Dr. Frank taught us if you do the right thing at the right time, oftentimes the body will heal itself instantly. I mean, that's a case of instant. The headache thing, it's instant. Acid reflux is very much the same way. Much of acid reflux is due to the stomach bulging up into the esophagus. Esophagus comes down here, your food comes down, it opens up through a valve and drops the food in your stomach, and then the valve is supposed to close. If the valve can't close because the stomach is bulging up into it, the food and the acid is going to come up. If that happens, damage occurs to the esophagus. The esophagus excuse me, is not made to handle acid. The stomach is. So if the acid comes up, you could get damage to the esophagus, and if it continues, you can get esophageal cancer. So that's why they give you these drugs that prevent your stomach from secreting the acid. But if you don't secrete the acid, you don't digest your food. If the food sits in the gut and rots, it putrefies, then you get damage to the gut, and that's called leaky gut syndrome. And then you have big food proteins going right into the bloodstream instead of being filtered out. You're not supposed to have big pieces of food in your bloodstream. It's supposed to be broken down and then filtered out, and then it goes in the bloodstream. So that's part of the problem with these acid reflux medicines. In addition, there's a higher death rate from infectious diseases if you're on Nexium and Prevacid and these types of drugs, because one of the things that your acid does is it breaks down bacteria and viruses. It breaks down the bugs in your system, digests them. If you don't have the acid, those bugs get free rein. So it's not a great idea. For a day or two, okay. Or if you end up with a big meal late at night, okay. But to do these regularly is a disaster. I had one woman, she said to me, it took 2 visits to fix her acid reflux. She said, I've been on Prevacid for 17 years. How come my doctor never did this? I said, I don't know, you went to the wrong doctor. He didn't know how to do this. They're not taught this in med school. We're taught this in chiropractic school, chiropractic techniques. So there's two parts to this that you can check. One is the sphincter, the cardiac sphincter, which is the valve between the esophagus and the stomach. Sometimes foods will cause that valve to stay open. Typical foods that do that are tomatoes or spicy foods, coffee, almonds, chocolate. Some of these foods may cause the sphincter to stay open. So if you notice you're getting acid reflux after you eat that food, either you have to stop eating that food or that food, you're having an allergic reaction to that food. So there's two things we check. We check for the sphincter and we check for a hiatal hernia. Hiatal hernia means the stomach is bulged up into the esophagus and needs to be pulled down. Let me show you the test for hiatal hernia. Come on and stand.
How do you spell that?
H-I-A-T-A-L. Hiatal hernia. H-E-R-N-I-A. Okay, so where your ribs come together, there's a little piece of bone that hangs down called the xiphoid process. So it's at the confluence of the ribs. I'm going to come right under that piece of bone, and I'm just going to twist a little bit to check the valve. So it looks like this. It's right under here, right where the cat's eyes are. And I'm just going to twist like that, and she's fine. But if it was not working properly, the arm would go weak. Did any of you think you might have acid reflux? Let's use you in this test. Let's just see.
I get more acid reflux when I eat red chilies.
Yeah.
I don't know why.
Yeah. So give me this here. Hold this arm out. Can you see this, Estefania?
Turn. Put her in the same position that Kim was in.
Let's go right over here. Hold that really strong. Hold. Good. So now now I know she's working. I'm going to do my swipe test just to make sure. Hold. There it is. Okay. So her body's talking to me. Now I'm going to come under the xiphoid, hold real strong, and bingo. So she's got it. So she has a sphincter that's staying open. It's easy to fix. And I'm going to show you the treatment for it right now. When I do this, I usually don't tell them. We're in the seminar here. I don't usually tell the patient this, but I'm going to tell it to you because we're at the seminar. It's going to hurt a little bit. I don't usually tell them. I usually just do it.
When you did this, it hurt right here.
Okay. This adjustment is going to hurt just a little bit. We're just going to tweak the valve. So I'm going to come in like this. I turned it to the right. I tested. I turned and put in a little pressure, and it went weak. That's telling me that this valve is not working right. Now I'm going to come in here, and I'm going to go, boom, like this. I'm going to shock it. Really, I'm going to twist my hand to the right. I'm going to put my 5 fingers in, and I'm going to shock this valve to start it working again. And we'll see if it works, then her arm will get strong. So it's not going to be too bad. So I don't know if you can see this. How about over here? Is this better? A better view? So I'm going to come in like this and shock it like that. It's only for a second. Well, let's see how we did.
Good thing that I don't have food in my stomach.
Yeah, hold. Hold real strong. So that's good. That's all you have to do. You just shock it, and it starts working again.
It's like work again. Like smack it in.
Thank you.
Okay? So you could get in there, boom, just like that, really quick. Don't tell them you're going to do it because they won't want you to do it.
Right.
So that's the first part. You want it done?
Yeah.
Do you have it?
I don't know. I might.
We could test.
Okay.
You get acid reflux?
No,
Huh?
but my stomach's always hurting.
Give me this.
So I don't know if I do or not.
Hold. So we'll just come in again under the xiphoid,
Turn the camera.
like this. Hold. Hold. So she's not trying 100%. So this is good actually, because you got to get the person to play 100%, because I'm getting a half weak and a half strong answer here. So hold real strong. See? She doesn't hold real strong. Immediate. That's it. You should have an immediate. Sometimes
She's worried about the camera, that's why.
sometimes you have to yell at them a little bit. Hold. Use a very authoritarian voice. Hold. Like that. Hold. That's it. Now, let's see what we get. Hold real strong. Yeah. No, you don't have a sphincter that's not working.
Okay.
Good.
I have something else maybe, right?
We'll check that later. Okay. That was good though, because that was a good example. Because sometimes people don't play 100%, they're just kind of lazy, you know, and you don't get a clear answer. So you got to, you know, make them snap to. This is serious business here, you know. Hold.
Next time we practice.
Right.
That's it. Okay, so now the next thing we want to check is the second part, which is a hiatal hernia, where the stomach is bulged up. Do you think you have that also?
What is it?
A hiatal hernia. Let's check it. It's part of acid reflux. So let's turn you this way. Now we're going to come in between the xiphoid and the belly button, about halfway between, and we're just going to push up slightly with our finger. So in other words, if she has a hiatal hernia, if the stomach is bulging up into her esophagus, we're going to push up slightly on the stomach. The body's not going to like that. It's going to know this hiatal hernia is being increased if she has it. If it's strong, she doesn't have it. If it goes weak, she has it. So let's just see. Hold real strong. I'll stand over here. I'm going to push up here. No, just stay like that. Stay right here. Hold real strong. No. So that was strong. She doesn't have a hiatal hernia, but she had cardiac sphincter, which is enough to cause the acid to come back up.
There was one visit where my stomach was up or something and you pushed it, but is that the same test for that?
Yes.
So maybe I have that.
Well, we can test it.
Okay, but that's what that is when the stomach is too high?
If the stomach is pushed up into the esophagus, yes.
Okay.
That's called a hiatal hernia.
Okay.
And that, so if this is the esophagus and the stomach is bulging up in there, the sphincter can't close all the way because the stomach's up there. So acid could creep back up there, or food creeps back up there, or you get a lot of belching and bloating.
I get that.
Yeah. Well, let's check it on you and see how it's doing. So again, hold really strong. Good. So she's giving an immediate response. It's firm. I know what a strong response on her is. Is her body talking to me? Yes. Fix it. Strong. Hiatal hernia check? No.
Oh, good.
That was fixed. Is that still holding?
Yes.
Okay, let's say it wasn't, because I got to show you how to fix it.
Right.
Kim. Kim doesn't like this one so much.
No, I don't like this one so much.
So hers is holding, but let's say it wasn't holding. So I would push up and the arm would go weak. Now, here's the treatment. Let's go on your back on the table. No, you can leave it on.
My back,
On your back.
my head here.
Head over there. This adjustment, this treatment, we call it a treatment, has to be kind of firm. And I had it myself. And I went to my chiropractor and had to go back twice, and he still didn't get it because he wouldn't do it firmly enough. He didn't want to hurt me. See, I don't mind hurting somebody. So you got to, so you got to do it really firm. I'm not going to do it completely firm because hers is fixed anyway. I don't need to hurt her unnecessarily. But it's going to hurt a little bit because you got to pull the stomach down. Now you can go to the hospital and they'll open you up and pull the stomach down for $75,000. Or you can come into my office and we'll just pull the stomach down for $72. And you don't have to stay overnight, no blood, nothing. You don't have to stitch you up. So why don't you come on over around the table and watch how we do this. And this is easy. I mean, it's really easy. You may have to do it a couple of times, but it's really easy, and it's very dramatic, and frequently it'll just stop the acid reflux that day. So I want you to bring your knees to your chest.
So you can also do it laying down? Same.
We do it laying down.
Oh,
No,
okay.
this is for the hiatal hernia.
Oh, okay.
We do it laying down. So I'm going to say, what I want her to do is I want to get her stomach muscles relaxed. So I'm going to tell her to take a big breath in, and when I say blow it out, you blow it out, and you straighten your legs at the same time. So just to make sure that the person understands the instructions, I do it like a dry run. Okay, so breathe in, blow it out, and straighten your legs. Good, just like that. Bring it back up. Okay, now we're going to do the same thing, except I'm going to come in here under the xiphoid, and I'm going to pull the stomach down. You might want to stand on this side, because I think you'll see it better. So, first thing to do, okay, big breath, blow. Now I get a lot of stomach tissue. See, I'm pulling down here. I get a lot of stomach tissue, and I pull down. And I'm going easy on her. And that's how you do that part. Then that's the first part. So you pull it down a few times, but you have to get in here and pull. You can't be a weenie about it. And then the second part is you come along the rib heads. Now the rib heads are about an inch off the midline, and we're just going to rub all the way down and up on the rib heads. So we start, here's the clavicle, right under the clavicle, and we just start rubbing these rib heads, massaging them a little bit. She doesn't like this that much. I won't do it too hard because this is just a demo.
You're massaging between the ribs?
On the rib heads.
On the rib heads.
On the rib heads.
Where it's connecting to your
To the sternum.
hair.
Where the ribs connect to the sternum, yeah. We're just rubbing those points. Massaging them a little bit up and down, and that's the second part of the treatment. And the third part, come on up, and let's stand right here. The third part is T8, the eighth thoracic. We're just going to adjust it. We're going to tap on it. So remember, here's the seventh. You can just, sorry, let your arms go down. Here's the seventh right here. Right underneath that is going to be T8. I'm just going to come in here like this. Breathe in, out. And that's the treatment. Now, there's an exercise that you can do, and I'll do it on myself. And what it is you come in with two hands, the point of your fist in here, right under the xiphoid, right under the confluence of the ribs. Then you put your other hand, your less dominant hand, over the top of it. And we're going to push in and down. Because the idea is we want to keep the stomach down. So this is an exercise after you do the hiatal hernia adjustment. This is an exercise that you can do to help it stay down. So it looks like this. And you're going to simulate. You can either lie on your back and blow out your air, or just blow out your air standing up like this. Just like that, to help keep it down. Now, after my chiropractor didn't fix it on me, I thought, well, I can fix this myself because I understand the basic principle. The idea is I want to pull the stomach down. So I just stood up and I took my hands in, and you can do this yourself. It's harder because it's harder to hurt yourself than for somebody else to hurt yourself, but you have to do it really hard. I came in here this way with my fingers, and I took a big breath, and I just pushed in. And as I exhaled, relax my muscles, or you could do it lying down. Pull the stomach down. Okay? So if you have to do it on yourself, you could do it that way. And you'll know because you'll either be having acid reflux or you won't. There's a third way you can do it, which I've never done. Dr. Frank taught us. And you can drink a gallon of water and jump off a step. That'll make your stomach, which is like a balloon filled with water, and then when the water hits down on the, when you jump down, the water pulls your stomach down and pulls down the hiatal hernia. You could do it that way. That's a third way to do it.
Kids
I,
are already doing that for themselves.
Right.
I think it's easier to do it this way than drink a gallon of water. Okay. So, do we want to practice that?
No.
You can just do it gently on someone. Don't do it hard. Just do it gently.
She's not going to want me to be her part person.
You can practice.
I go a little too hard.
Let's try. Let's have a practice session so when it comes to really doing, you know how to do it. So Sarah, you want to do it on Sarah first?
Sure.
Okay. So, all right, I tell you what. First, let's do the test. Do the muscle test for hiatal hernia and for cardiac sphincter.
Okay. So you're gonna hold,
Kim, why don't you pair up with Hilda?
and then it's like right here.
Well, the first one is a twist, right?
With the twist?
Here's the xiphoid. Right there, right under the xiphoid.
I'm gonna
Yeah,
go up here.
5 fingers, but use your other hand
So you use this hand, right?
and
Okay.
twist it
Twist it.
and hold this.
Okay, so she feels good.
Okay, and then come a little bit, an inch or two under that, halfway between the belly button and the xiphoid.
So right here?
1 finger and push up. Push up. That's it.
Okay, hold. Sorry for my nail.
It's okay.
Okay, so she feels okay.
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 So if she did have it, it would have gone weak. So what you would do is you come in here and you in and torque. You don't have to do it on her. but
Okay, so we'll just simulate
Just
it.
pretend.
So sorry for my nails. So in and toward like that.
Firm. Yeah. And then you would test again, see if you fixed it.
Okay. Okay, so that would be that one.
And then if she had a hiatal hernia,
Hernia.
then let's see how you would do it there.
So then you're gonna put your knees up. And
Feet
you're
on the
gonna
table.
Put your feet on the table, and then you're gonna take a deep breath in, and then you're gonna exhale and straighten your legs.
Good.
Okay, so then we're gonna do that again.
But this
I'm
time,
gonna pretend, both hands or just one hand?
I would do 2 hands so you can get a good firm hold of the
So then I'm
tissue.
gonna find her xiphoid process again.
You come under the xiphoid, yeah, down
You come
below it.
Starting here.
And then as she blows it out,
So you're gonna blow your air out and straighten your legs. And I'm gonna simulate pulling your
Pulling down
stomach
really hard.
tissue down.
and you do
Not
it,
too hard? Okay.
and you do that a few times,
Okay.
and you really.
So you
So then
have
she
them
breathe
do
in
this.
again a few times.
You
No.
have them-
Or once she straightens
No,
her
once
legs
she's
once,
blown it
then
out, you
I
just keep pulling.
Just keep pulling.
Yeah, so when I do it, straighten your legs, blow, and I come down, I start pulling, and I come up a few times, and I keep pulling
He's
down.
a lot tougher than I am on you. I can
I'm
tell.
barely doing it. This is nothing.
Okay.
And then
All
you
right.
do that. And then the last thing you do is T8.
So then, okay. So.
Sorry, you do the rib heads.
So after we torture her here, so I'm just kidding. So the rib heads come connect right.
Yeah,
up here.
right there, and rub them, and then just go down.
Okay, so I feel like I'm fine now. And then you go all the way down
Yeah, all the way down here.
to the xiphoid.
Down to the bottom of the ribs here.
Okay, so that's the end. Okay,
And they're tender on her.
Yeah,
Yeah.
it's pretty tender.
Yeah, and then you go back up.
and then I come back up.
Yeah.
So then I'm gonna rub here. Am I being too tough?
No, it feels nice.
Nicer than when he did it, right? Okay, and so the last thing I'll do is carefully stand up. And then so the, under the scapulas,
Is 7,
and then I'm gonna come down
1,
1.
about an inch.
So
So
my-
here's 7, here's 8.
So,
And then just on 3 phases of respiration, tap her on the back.
okay, so,
Tap right there,
so
make
I'll
a
just use
fist.
like the
Yeah.
hand like this. Okay, so just breathe normal, and then breathe in, and breathe out.
Good.
Okay, and now we're gonna test you, so hold strong. I don't touch anything to test it.
You test her in the clear, and then
Touch it.
test the hiatal
Right
hernia.
here?
Yeah.
Hold.
So this is
This is
Hold.
C7.
That's how you would do it.
Okay.
I want you to switch.
oh yes, you're right.
That had a nice burp too.
Oh, okay, good. Yeah, well, that's what I was thinking, like when you have a baby and they're gassy, you kind of like do the same thing with the legs and push the stomach down, so.
Good, now switch.
Okay.
Okay, oh, so you want to test me first?
Yeah. But I want you to put that arm on.
Okay.
Okay. So.
Test her in the clear.
Oh. Okay. Pull. Pull.
That's strong. Okay, it should be strong. Now go down, Sarah.
Pull.
Stabilize on her left shoulder with your other hand.
Oh, she's weak. Okay.
Now, fix her.
Okay.
Good. You feel it lock?
Yeah.
That's how it should be.
Okay. So this is the twisty thing.
5 fingers and torque it.
Hold. Sorry. I told you hold after.
Okay, that's why we're practicing.
Hold. Okay. You seem strong there.
Now push up.
Hold. Oh, you're weak.
No! You didn't hear that. Okay, so, so I'm weak, so I need to do that.
Do you? Let's double check it.
Okay.
Can I check it?
Yes.
Give me this. Hold that really strong. So this is the cardiac sphincter. That's good. This is. Yeah. You're right. You found it.
Good
So
job.
you have a little bit of an acid reflux issue,
We're not
huh?
diagnosing here, so.
You wanted to fix it?
Yeah.
Okay, fix it.
Okay. Please lie down.
Oh, boy. Making a real difference in people's lives today. Okay, so I'm gonna breathe in. Right. So I'm gonna breathe out, straighten my legs.
So breathe in. You breathe out, straighten your legs. Okay, bring your legs back up. Breathe in and breathe out.
You have to do it pretty firm. That's it. Good. Keep going down. Pull it down. Get in there and pull it down. That's it.
Ouchie. Okay, and then what?
Ribs.
Ribs. Okay.
Firm. You gotta do this firm because this is for real. We really want to fix her.
It's okay. You're okay.
You gotta say what he says. This hurts me more there.
Yeah. Do you, and you go back up.
And back up. Firm. Is she doing firm, Sindra?
Yeah.
Or is she being
Now
a,
that you said that,
is she being a weenie?
she's doing it.
Okay, good.
Okay.
She's strong enough.
Then what?
T8.
Okay. It's so funny because like you do all these things and then now get up. Okay.
Find 7.
Put your arm behind your back for me.
That's it. Good. Here's-
Here.
yeah.
7.
7.
8. Okay. Breathe in.
In. Out. Good. Now let's test. See if you fixed it.
Oh, you wanna do this
Yeah.
regular first, right?
Hold. Hold. Yeah. No, I think it's still weak. Hold on. Hold. It's better.
Oh, it's strong.
I think so.
Yeah, I could see it. Her arm didn't come down. Hold that. That's good.
I did
Good job, awesome.
Watch out.
Good job. Well done.
She's gunning for you, Joe.
All right. Great. All right.
It's hard to be firm, you know.
Yeah, you got to do it firm so that you fix it.
Yeah.
You want to really fix this. And anyway, any pain you cause, it's just going to be like temporary. It's just going to be like a little tissue pull. So it's not going to be it's not going to be a big deal. Okay. So we've got acid reflux. That's a big one. That's a big one. Let's talk about plantar fasciitis. Anybody have plantar fasciitis? Pain along the bottom of the foot?
I used to.
Okay. So this is going to be a little technique. This technique it's kind of like shiatsu massage. Shiatsu massage is like firm, steady pressure, like what we did with the headache technique. Remember where we pressed under the skull, we held those points under the skull and not wiggle them, but just put steady pressure 5 to 8 seconds. What you'll find on the bottom of the foot with people who have plantar fasciitis is along a line here, you'll feel a lump where it hurts when you press on it. It'll hurt them when you press on it. You just apply the same type of pressure that you would like under your skull along that plantar fascia. Fascia is like connective tissue. So when people step or move their foot, it hurts. If you press along that plantar fascia, you'll get that lactic acid out. You might have to do it every day for a few minutes or do it on yourself. If you get that stuff out, the muscles and the fascia relax a little bit, it doesn't hurt anymore. So you can do that. You can do that either every day on somebody, if it's like your husband or your wife or something, or every other day until that comes out. That's how you can deal with plantar fasciitis, which is a lead up to how you can deal with a lot of other issues, muscular issues that people have with this stuff that we call lactic acid. Remember, lactic acid is a waste product. It comes from overutilizing the muscles, and everybody just about that you meet is going to have it along here in their neck. So one way that you can deal with it on them, if it's a friend or a relative, whatever, is by pressing that stuff out. And you can do it in any muscle, but I'm gonna demonstrate it along the whole spine, because people get tight in their mid back and they get tight in their necks and their low backs along the spine, and a lot of times it has to do with lactic acid being built up. So, Kim, can you lie down on your tummy? So, in chiropractic school, we learned this technique. It was named after Dr. Raymond Nimmo, but it's very similar to shiatsu massage. So, from the base of the sacrum all the way up to the neck, these are the erector spinae muscles along either side. And people frequently have pain and discomfort on here and or across, like right there. Like, that hurts, right? If you put your finger here, you'll feel this lump. Feel that lump in there?
No.
Go ahead, feel it. Feel it? Is she on it?
Mm-hmm.
Yeah.
I have many lumps, so.
Cinnamon, you want to feel this? So you know what it feels like. Just roll your finger over right where mine is. So don't walk, just roll. Feel that roll? Mm-hmm. Feel that lump under your finger? Mm-hmm. She's on the right spot? Mm-hmm. Yeah, okay. So that's lactic acid. So if it's in this part of the body, we're going to do the same thing as we're just going to apply pressure 5 to 8 seconds along those points. So I'm going to look for it on Kim. Is that hurt? Mm-hmm. Yeah. So this is, I can feel because I'm rolling over the bump. You'll feel the bump under your fingers. So I'm going to take it And I'm going to put steady pressure direct on it. I'm not wiggling it around or moving. I'm just steady pressure till it, I don't want to torture her, till it hurts a little bit. Is that too much? No. How about here? Yeah. How about here?
Not so much.
Not so much. More up here?
No, yes.
That's a yes. When they scream, you know it's a yes. Is that too much?
No.
So I take it up to a point, because the more pressure I apply, the quicker I'm going to get this lactic acid out. How about here? Yeah. So she's got up and down there, from about the bra line, bra strap up to her lower neck. Yes. Anything here? Yeah. Let's look at the other side. Anything in here? Yeah. So that's also tender. And here? It's a very yes.
Yeah.
And here?
Yes. Yes. Yes.
Okay. So I would work all of this on her for a few days and get some of this stuff out. Now, let's say it's a big, strong guy and your fingers aren't that strong. Well, instead of using your fingers, you can feel it with your elbow. So you use the flat of the elbow. So it would look like this. You come on the, you wouldn't cross over the spine, because you'd end up hitting on the vertebrae. So you just come off the spine on the same side, like this is the left side of her body, I'm standing on the left side of the table. I'd come with my elbow like this.
No.
And that gives you a lot more leverage to press that stuff out. So like your husband would probably be better off doing it with your elbow. And so then you would, and you'll feel, if your elbow gets sensitive enough, you'll feel the painful, the lump, like right there. And then you just come up slowly and hold it. And come up again and hold it. Is that too much? It's enough, huh? And here. Also? So that's, now you can also do that up here in the neck. You might want to sit at the head of the table and do it with your fingers and press in this way.
That's too much.
See, I'm hardly pressing at all, so she's tender up there. This is where,
That's too much.
that's where a lot of people, sorry. You're doing great, Kim. So that's where a lot of people have it. It feels really great when you stop.
Yeah, when you stop.
It's a joke. Okay. Right there also?
Yes.
Yeah. And here too?
Yes.
Here too.
Yes.
So for necks and shoulders, you'll find this a lot. These are the trigger points. And if you apply that pressure to it, you'll start to get that lactic acid out. You might have to do it 2 or 3 times a week for a few weeks to get much of it out. But it probably feels a little bit better already. And I think some of you have had this done in my office, where I've pressed on some of these points. Yeah.
Lots of things.
Huh?
I feel like you press on lots of things.
Yeah. Yeah. That's the reason we do it, because you want to press out that lactic acid. So let's why don't you all have a seat? And Kim, yeah, come on up. You did great. This would be a position that you could do the shoulders in. So if we have you pair off why don't two of you get behind two others and press on these points on the shoulders, and I'm sure you all have them. Okay? So you can see what it feels like. So you were talking about your shoulder, so what you would come, is that tender?
Stay in that area.
Yeah.
Over here, stay in the area. Oh, over here.
Oh, should we move the chairs there?
No, oh, for them, yeah, if that's okay.
Okay, let's move your chairs up here. And face this way?
Yeah,
Yeah.
that's perfect.
So why don't you come over with Hilda and work some of those triggers on her shoulders. And this is how you can deal with shoulder pain also.
Does that hurt right there?
Oh, yeah.
You feel them?
You feel it pretty easily, huh? Does that hurt right there?
But it's pain, but feels good at the same time.
You using your knuckle?
Yeah.
Your thumb isn't strong enough?
Well, I try to save my thumbs
Okay.
because I'm a massage therapist.
Yeah. So you know how to
I
feel
have a-
those
I have a-
points.
I have a habit of not using my thumb.
So in your line of work, you know right where to go.
I don't know. There's an energetic about it. It's definitely the right side.
Yeah. Just funny, because I'm left-handed.
I know, yeah. It's the same with me sometimes.
Oh, yeah, you said you're left-handed as well.
I think I'm done. I think I've got everything in I want to do.
Okay. Done ahead of time, it's fine.
Okay.
Okay, so far. Maybe if you roll around a little, just roll around, you feel the difference, like the muscles, like, like if you just take your thumb and sort of roll up and down. I'm kind of tight.
No, I was gonna say, well, I didn't wanna say it like a weird way, but you're tight everywhere, so it's kind of hard for me to tell if that's just because you're fit or if you're just really tense.
Yeah. It's both.
There you go.
Or do you get more back here?
I don't know. I don't get a lot of work done. So. But I should. I feel like it, my stuff is more like
Okay.
much better.
It's like where he was doing on cam.
Yeah, there's something there. Yeah, yeah, you're right.
The pressure and you just breathe through it.
It's so tight I can barely even tell what you're doing.
Can use my elbow.
You could try. Yeah. Yeah, just
On the right side, yeah. That I feel. Can you feel it as well?
Can you talk through what's going on?
Okay.
What are they doing?
So now they're pressing out these lactic acid points that people frequently have in the shoulders. Because we move our head up and down so many times a day, and especially if we're doing computer work, we've got our head in this position for hours a day, it really strains these muscles. So everybody seems to develop trigger points across the shoulders and the neck. So what they're doing now is pressing out those lactic acid points by holding them 5 to 8 seconds. Not rubbing them, but just putting steady pressure on them. Unfortunately, we're in an era where we're going to see more and more neck problems in younger people because kids are doing these cell phone things and they're texting. And they're in this position frequently for hours a day. Well, when you get your head in this position, you take the normal curve out of the neck. The neck ideally should curve like this. From the side, it should have a curve towards the front. Well, when you're bent over like this, you're doing this to the neck. You're taking the curve out. The normal lateral curve is being reversed, and when that happens, it changes the mechanics of the neck, and the neck starts to wear out. And that's why we're going to see more and more early arthritic problems in people's necks. Because when I was in school, of course, we're looking at books a lot, and so that would take the curve out also. So people have to get used to having their chin up while they're doing their typing on the computer or they're texting, having their chin up and using their eyes to look down as opposed to putting their head down this way. Because if you continue to spend time with your head this way, you're going to take the curve out of your neck, and then 35, 40, 45 years old, it's going to be worn out. And you're going to have arthritic spurs in there. Yeah.
Press. Yeah. Yeah.
Okay. Good job. You feel them? Yeah. So you can do this to family members, regularly, and break up some of that tension, some of that stress. Okay, I want to cover another technique, has to do with constipation and diarrhea. There's a valve called the ileocecal valve, and it's located just to the right of your belly button and down about an inch or two. So, Kim, can you stand? So the ileocecal valve is going to be about here. Can you see this? When that valve is open, you have diarrhea. When it stays shut, you have constipation. So the idea is that you want that valve to be working properly. So what we do is we shock it similarly to the way that we shock the hiatal hernia, the cardiac sphincter involved with hiatal hernias. We shock it. So what we would do to test it, hold that real strong, is I'd come here and I just swipe against this ileocecal valve, just like this, hold. And hers is strong. Or I swipe up and it's also strong. Either way, if we find a weak muscle, and especially if that person, the way you might look for it is maybe your kid has diarrhea or maybe he's constipated. You could test him this way and then do the treatment. And what you can do for the treatment is just take both your thumbs, come in here, and just give a little thrust like this. So you shock that valve, so it would look like this. Doesn't have to be real hard. Just shock it. to try and get it working again, and then retest the muscle and see if you did. And then see if their constipation and or whatever it is, diarrhea, if that changes. So that's another thing we can do. It's a simple, easy technique. Just shock it. You know, it would probably, I don't do it this way, but probably if you just smacked it, that would be enough of a shock to get it working again. Thanks. So that's also something you can do for constipation or diarrhea. So, any questions about anything we've talked about so far? So, if you think about health overall, you'll probably realize that lifestyle has a lot to do with it. Yes, there's genetics and there's accidents, but lifestyle is a big thing when it comes to healthcare. And if your lifestyle is burning the candles at both ends and all you consume is pizza and beer, eventually the body's going to break down. So you've got to give it the building blocks that it needs, the nutritional support it needs. You got to give it the rest that it needs. I mean, this body, we go to sleep for a particular reason, to rejuvenate. If you don't sleep, the body doesn't rejuvenate. And of course, you know, you feel lousy. That's the problem with people that have fibromyalgia. They don't get good sleep. The body doesn't sleep well. They don't get deep REM sleep, and so the body doesn't heal. So these pains continue to build and become problematic. One of the symptoms of a fibromyalgia patient is lack of sleep. You just can't sleep. So lifestyle is important. And we're going along with that, it's become more and more obvious that meditation is a really good tool for decreasing stress in the body. It's a mental technique, but it works on the physiology. So I've been doing it for many years, and I'm convinced that the reason at my age I still have 120 over 180 blood pressure is because stress doesn't come into my body as easily as it comes into other people's bodies, because I'm doing this meditation every day, which is decreasing the stress levels. And the physiological testing, like lactic acid tests and brainwave pattern tests, all show people who meditate, they have less lactic acid in their bodies, which is a stress marker. The heart rate goes down, the breath rate goes down, and they get a deeper level of rest than you even get in sleep. So if you really want to plan for the future, start incorporating a meditation technique into your life. I like, if you Google up Soul Sync meditation, that's a really nice 15-minute meditation that you can do every morning, and it's a guided meditation, and this woman, Preetaji, takes you through it, and you just feel rejuvenated. And so you get used to doing that, and you know, things like high blood pressure and et cetera, don't occur so often. There's even a recent study during COVID, people who meditate get sick less often than those who don't with COVID, because the body has a stronger immune system. So if you take care of it and pay attention to it, it can last. And then these are techniques that we taught you today that will help with specific problems, and they're common problems. But now you have things that you can deal with that you don't have to go run to the doctor all the time. So any questions about anything that you want to discuss before we wrap up?
Well, so you brought up two big things, but then now I want you to show us how to address it, like adrenals and immune system.
Okay, well.
What was the question? Can you repeat that?
Now, so she said now that I brought up these issues, she wants me to address the adrenal glands and the immune system. And there are techniques within this TBM protocol for dealing with those things. Um, they get a little bit more complex, and they probably be the immune system. There are points for the immune system, but we'd have to go into really a lot more detail to that would be like an advanced class, and maybe we will do that in an advanced class. If we want to do something more advanced, we could do that also. But there are techniques to deal with blood sugar. There's techniques to deal with fibromyalgia, techniques to deal with adrenal fatigue, techniques to build up and boost the immune system. But it's a little more complex than what we could cover today. But it's a good question. And maybe either, I would say, take the whole TBM protocol, which is multiple weekends taught in various cities around the country. And that's a really in-depth program. What we did today was touch on some of the things that anybody could do really easy for themselves or for their family members. So I'm going to beg off on that question. Because we do it's a lot more complex, but we do that in the office. We've done that with you in the office.
Yeah.
But to teach it here, takes a little bit more knowledge, a little more in depth. So I'm going to bow out on that one. Anything else we want to talk about?
So this might fall into the same category as Sarah's question, but in thinking back when we were talking about how to look at asthma, and a lot of times it goes hand in hand with allergies, is there something you can show for that? So let's say not diagnosing an allergy, but let's say that you have an allergy that's triggered the asthma. Is there something that we can do in tandem
for the allergy?
For the allergy. Or even like, I think we talked about it, and again, this is probably going too far afield, but let's say I want to start taking a supplement. Is there a way I can like muscle test
Perfect.
something before I take it?
Yeah, that's a good question. Okay, good. So the allergy technique it's a little complex. So the question is, in addition to asthma, is there anything we can do to handle our allergies ourselves? And what about testing of our supplements? So when I mentioned earlier that frequently, if somebody has allergies and asthma, I want to treat them at the same time. You can treat the asthma. It was easy. Touch here, touch the bladder point, and hit L5. The allergy technique is a lot more complex and involves a lot of other testing that is not really suitable for this class. Mm-hmm. But what is suitable is testing supplements. So,
I have some on my bag.
okay, why don't you bring something out and let's just see.
We didn't plan that.
No, but it's perfect.
Nice.
Perfect. Actually, because it's something I wanted to cover.
My traveling pharmacy. I have.
So this is going to involve surrogate testing. Okay, let's just put a couple of them up here on the table. And let me show you surrogate testing, because maybe you have a baby that you think has acid reflux and you want to test the baby. Well, the baby's not going to hold his arm up. He's 6 months old. So you would use a surrogate. So why don't I use you and Kim? So Sarah, you stand here. Can you see Estefania?
Yes.
This work? Get closer here. You touch her shoulder. Okay, so here's how surrogate testing works. She's 6 months old. She's not going to hold her arm up, so she's laying on the table. We take her mom, and we connect the mom to the baby. And then I test the mom, because the electricity is going to go through to Kim. So if I do this, hold. Now, to make sure that I'm really getting answers, I do the swipe test on Sarah. Hold. And that happens.
Who's the baby? I'm the baby.
Sarah's the baby. So that's working. So now I fix it. Now, I know I'm getting answers. So now I can test whatever I want to test on the baby by the surrogate mother. So let's say you're in the grocery store with your boyfriend or your husband. you want to test, well, let's see if this supplement is any good for me or if this supplement is bad for me. So what you can do is and this is the way I do it. So let's say I want to test this on me. Okay, so I'm going to I don't have good muscle testing skills to test myself. So I use this, you touch me here. So now we hook Kim up into me. Now I'm testing myself. Now, if I'm getting the proper answers, when I do this swipe, hold this, that should happen. When I fix it, that should happen. Now I'm getting answers about my body. Now, so you can do this in the grocery store, it's going to look a little weird, but so what? So now I want to know if this echinacea is, how does my body react to this? So I do the swipe test, and then I put this up against my body. If it negates the swipe test, this is something my body really likes.
So if you're strong again.
If I'm strong again after the swipe test with this on my body, that means this has negated the negative aspect of the swipe test. So if my body really likes this a lot, it'll be strong, and it is. So my body likes it because if I did just this without that, this happens. So that's one way to test if a supplement is really good for you. If a supplement, if we just put it on the body and test, well, this is telling me that it's not bad for me.
But it's not bad for you.
It's not bad for me. It's not. I don't know if it's fantastic or not. But if I do this,
That's maybe something your body wants.
it's as good for me.
Yeah.
My body likes it. This one, so now I should be strong. Now if I put this on, it's not bad for me. And my body likes it also. And let's see, is this bad for me? No. How is it for me? Doesn't do anything. So this Minchex is of no value for me. But these others could be. And this is what, ginseng or something?
No, it's a bunch of herbs for relaxation.
Okay. So we could test it also the same way. You follow what we just did?
Yeah, it's great, thank you.
Yeah. So that's how you could go and test stuff, or you could, whatever supplement is. So let's take it a step further. Let's say you know you have a liver problem. I'm not saying you do, I'm just saying let's say you do. So what we could do is, or your girlfriend or your boyfriend has a liver problem. So we could touch the liver area. This is called therapy localization. You touch the liver area, and you don't, but let's say you did. Let's say if it went weak, then what you could do is, let's say you're into aromatherapy, or you're into Bach flower remedies, or you're into standard processed herbs. You could take your kit, if you have a kit of these things, or take a bunch of them, and put your hand, so no, not yet. So first, ahead of the program. Okay, I know you're knowing this stuff. I know you're getting it. So here, the liver goes weak. Now you put your hand on that stuff. If this test goes strong, that's telling me that there's something in there amongst these supplements that your body likes. Then you got to go either, let's say you had a whole kit of aromatherapy, so you put your hand on the kit and it goes strong. Well, now you take these 10. Oh, it's weak. These 10, weak. These 10, oh, something strong. Then you process of elimination, you figure, oh, is it in these 5 or these 5? And then you figure out which it is. And then you would take that one out, put it on the body while you're holding the liver, and see if it makes it strong. And then you know you have something that your liver likes.
Okay.
Got it?
Yeah. But you didn't do, okay, you don't need to do the
No.
negative test first.
No.
Okay. If you're just doing one thing alone, like, do I need this or not?
If you want to find out if something is, or you can do this with an allergen too. Let's say if you find out you think you're allergic to cedar. So go out and get a little cedar and put it on your body and muscle test it. If it goes weak, you know you have an allergy to it. You know your body doesn't like that. It's giving you yes or no answers. Does my body like it or not? With cedar, it's a no. With this, it may be not a no, but it may not be great either.
Gotcha.
So if we put this on you, and I do this, your body really likes this, whatever this is.
Yeah. Echinacea.
See how that works?
Yeah.
So now you have, practice this, because then you'll have the ability to go out and test the stuff. I'll tell you, if you go into CVS or Walgreens and start buying the supplements, you're going to test it. Most of them are going to go weak on you, because a lot of it has junk in it. It may not be the vitamin E, but it may be the filler that's with the vitamin E that your body doesn't like. Yeah. That's how that works.
Cool. Thank you so much.
Yeah.
I'll do that.
Yeah. Good question.
Thanks for coming prepared. Yeah.
Yeah, I want this. I'm glad you brought that up, because that's something that you can do now. And that's something I do in my office. I'll take the supplement and test it on you. Is it good for you or not? Any other questions? Anything from anybody at home? Questions?
I don't think we have an audience.
Okay.
Couple people say. But before I say that, let me just go on Facebook really quick. And check.
Okay, so there's one other thing I want to brief you on. We want to get these treatments that we do to hold. I brought a couple of blocks with me. Let's use Kim again. Let's go on your back. So after we do an organ treatment, like let's say we did acid reflux or we did asthma, we want to encourage the body to have it hold. So I've ordered some extra of these blocks. If you want them, I have them in my office. So we want to put the person in a relaxed state so they accept the treatment. So what we do is we come and we look at the hip pointers. And usually one of them is going to be higher than the other. What we'll do is we'll set these wedges in this way, through the highest hip pointer and then through the opposite femur head. So it looks like this.
Which one's for higher one?
So in this case, I'm looking, this left one is slightly higher than the other one.
And when you say higher, is it higher?
Higher towards her head.
Okay.
Towards her head. So I'm going to take this wedge and slide it in here this way, and then at a 45-degree angle. And then where that comes out, I'm going to slide it in this way, and the other one at a 45-degree angle. So this type of blocking puts her into kind of a relaxed state. So now I'm going to have her hold her arms out at about 20-degree angle off the body, and I'm going to press down. And I'm going to say hold. And it's going to lock. And I'm going to say relax. And she puts her arms down. And I sit with her, and I wait until about every 20 seconds, 10 or 20 seconds, I keep testing until the arms drop. When the arms drop, that's telling me the body has accepted the treatment, and I'm done. Pull out the blocks and send her home. Or pull out the blocks and have her go make dinner. Whatever it is. Go play with the other kids. This is called blocking, Category 4 blocking. We do it Category 4 blocking after an organ adjustment. So we want it to hold, like an asthma treatment or an acid reflux treatment. You can also substitute a pair of shoes for the blocks, or a pair of boots if you don't have any blocks. So hold like this, okay, and it's going to be strong. Eventually, it's going to drop down weak. And then when it does, we pull the blocks out and we're done. And we do this every day. That's how we do it in the office. Kim has been blocked hundreds of times. And this is how we know we're done with the treatment. And so now, boom, it's gone. Now we just pull the blocks out and we're done. So I ordered some extra blocks. If you want, call my office and we'll get some. And of course you can get if you need the pelvic balancer, we brought a few extras today. And if you need that for hip adjusting, we have it in the office, so you can we have a couple here today.
I've already been using it on clients.
And how's it been?
It works.
It works. Yeah. They report their back pain is better?
Yeah, it helps. I did it on one client before I did the rest of the treatment, because I figured to start with that and then do the rest of the treatment, and it hurt. She left and she said, oh my God, my back feels better. So I'm guessing, everything together was helpful, but
Yeah.
It was nice to have that because I could immediately see the difference.
You saw the leg change.
Right.
Yeah.
Yeah.
Yeah, it's great. I mean, I tell you, I have patients, I haven't seen them in years. They got the pelvic balancer, they're blocking themselves, they're family members, people in the neighborhood. It's great. It's great. Okay, well, if there aren't any other questions, I guess we can end a few minutes early. We didn't have a lunch break, so you can go do that. I hope you enjoyed it. We had fun, and I hope it was helpful.
Yeah.
All right. Thanks.
Thank you.
And I'll let you know, doctor, how my treatment went, because I did postpone my surgery.
Okay.
So
Good.
I'll let you know in a month, almost 6 weeks. See how it goes.
Yeah, you should see a difference in a week or so.
Yeah.
Excellent.
Since you did the acid reflex treatment on me, I didn't took notes. Could you write down what you did on me?
Why?
What you did on me when you do the technique?
We adjusted the cardiac sphincter.
Can you write down please to me?
I said, "Do you want a sheet?"
Cardiac sphincter.